The metal tray left his hand before the orderly even had time to step back. It hit the wall beside the door with a sound like a gunshot. Flat, hard, final. And the medication scattered across the linoleum in every direction. Pills rolled under the radiator. A capped syringe skidded to the baseboard. The breakfast tray on the bedside table shook from the impact, and the half-full water pitcher tipped and didn't fall only because the overnight nurse had braced it out of reflex. "Get her out of here," Colonel Raymond Voss said. Not shouted, said. The kind of voice that didn't need volume. "I want her out of this room right now." The woman standing at the foot of his bed hadn't moved. She was in her mid-30s, medium height, dark hair pulled back, badge clipped to the front pocket of her scrubs. Her hands were at her sides. The tray had missed her by almost 3 feet, and she hadn't flinched, hadn't stepped back, hadn't reached for anything to hold on to. She just looked at him. Raymond Voss had that effect on people, had used it for decades, in briefing rooms and field operations and the particular kind of institutional confrontation that military hierarchy produced, and the effect was always the same. People moved, people apologized, people found somewhere else to be. This one wasn't moving. He didn't know what to do with that yet. If you've made it this far, stay with me until the end, because what happens next is going to surprise you. Follow along, hit like, and drop a comment with the city you're watching from. I want to see exactly how far this story has traveled. The morning had started the way most mornings started on the 3rd floor of Hargrove General Hospital in Dunmore City. Short on staff, long on problems, and running entirely on institutional habit and bad coffee. Claire Merritt arrived at 6:52, 8 minutes before her shift technically began, because she always did. She changed in the locker room without much conversation, clipped her badge, pulled her hair back with the efficiency of someone who'd learned to do things quickly in the dark and under pressure and without a mirror. The night crew was finishing handoff when charge nurse Deborah Falk caught her in the hallway with the look of someone who needed a favor and wasn't sure how to ask. "I need to move you," Deborah said. She was in her early 50s, compact, permanently tired the way people got when they'd been good at a hard job for a long time. "Room 318, new admit from overnight." Claire looked at the assignment board. Her name had already been moved. "What's the situation?" Retired Army Colonel Raymond Voss, 61 years old, came in through the ER around 2 this morning. Bilateral leg infection. Been building for at least a week, maybe longer, before someone convinced him to come in. Fever's running 103, cardiac history on file. Deborah paused just long enough to mean something. "He's already sent back 2 nurses. Already? It's not even 7. Renata lasted 40 minutes. Torres walked out after 20. Deborah's expression stayed neutral in the practiced way of someone who'd stopped editorializing out loud. He has preferences about who he wants providing his care. Claire understood what that meant without needing it mapped out. What kind of preferences? The kind that come with rank, a long career, and a lot of years being the most important person in whatever room he was standing in. Deborah handed over a tablet with his chart open. He specifically requested male staff. "I'm short 2 orderlies today, and the only available male nurse on the floor is Marcus, who cannot come off ICU overflow. So here we are." "So you're sending me?" "So I'm sending whoever I have, which right now is you." Deborah held eye contact. "You want to pass on it? Say the word. I'll sort something out." Claire was already reading through the chart. "I'll take it." The overnight vitals were worse than the fever alone suggested. Blood pressure had been erratic, spiking, then dropping, not settling into anything that looked like a trend. There were notes from the ER physician about early systemic involvement, inflammatory markers running high, a wound assessment that used the word aggressive twice in 4 lines. The infection in his legs wasn't local anymore. It was moving. And he'd given it a week to move before coming in, which meant whatever was happening under those bandages had been organizing itself in the dark for days before anyone got eyes on it. She walked to 318 and knocked twice before pushing the door open. The room smelled like antiseptic, and underneath it something stale and close. The smell of a person who had been sick longer than they'd told anyone. Raymond Voss was in the bed with the frame of someone who had spent decades being physically powerful and the particular stillness of a man who hated needing to be in a place like this. Large shoulders. Gray hair cut short and still somehow precise. Eyes that tracked her from the door to the middle of the room without moving the rest of him. "Third one." he said. It wasn't a greeting. Claire Merritt. She moved to the wall mount and pulled up his chart. I'll be your nurse today. I told them I wanted someone else. I know. She checked his IV line without looking at him. The insertion site was fine, but the line had shifted slightly. She could see it had been retaped at some point in the night, and not quite right. Your IV line slipped overnight. I'm going to resecure it. Did you hear what I said? She looked at him then, directly, without aggression, without apology. Yes, Colonel. I heard you. She kept her voice even, not flat, not warm, somewhere in the register that said, I'm paying attention and I'm choosing not to react. Your preference has been noted and it'll be relayed. Right now I need to look at your legs. My legs are fine. They're not. She set the tablet on the tray table and moved to the foot of the bed, pulling back the sheet before he could object further. The dressing on his right leg told the story immediately. The bandaging from the ER had already started seeping through, a yellowish stain spreading from the edge in the way that meant the wound was weeping more than it should. This needs to be changed. I didn't ask for your assessment. No, she said, opening the supply cart beside the bed. That's why it's free. There was a pause. Something shifted in his expression, not softening, not warmth, more like a small recalibration. He had expected her to flinch when he pushed back. He'd expected an apology or an exit. She'd offered neither, and that had briefly disrupted whatever script he was running. You don't know what you're walking into, he said. The edge in it was still there, but slightly less organized. I've had combat medics rotate through my unit with more medical training than everyone on this floor put together. That may be true. She was already laying out the dressing materials in the order she'd need them. Can you lie still for about 8 minutes? I can do whatever I want. This is still America. Good. She snapped on her gloves. Then please lie still. He didn't respond, but he didn't move either, which was close enough. She worked carefully, removing the compromised dressing layer by layer, taking her time with the tape edges where the skin was already fragile from the fever and the inflammation. The wound beneath was worse than the overnight notes had indicated. The redness had spread, not the clean, bordered redness of a localized infection, but the irregular, reaching kind that suggested it was finding paths through tissue and following them. Both legs were involved. The right was significantly worse. There was a section along the medial calf where the skin had a tight, shiny quality to it that she had learned over years to take seriously. How long has this been bothering you? She asked, keeping her eyes on what she was doing. Couple of days? The ER physician's notes put the wound margins at closer to a week, maybe 10 days. His silence confirmed it. Were you running fever before 2 days ago? Felt warm. Did you take anything for it? Pushed through. She finished cleaning the wound edges and began applying the new dressing, pressing carefully at the margins to ensure adhesion without putting pressure on the inflamed tissue underneath. Her hands were steady. They were always steady. Had been steady through things that would have made other people's hands shake, and a hospital room in Dunmore City was not even close to the worst of it. Pushing through works for a lot of things, she said. It doesn't work for this. He turned his head to look at her. Who told you it was that serious? Your chart, your labs, the wound I'm looking at right now. She smoothed the final edge of the dressing and stripped off her gloves. I'm not diagnosing you, Sec. That's the attending's job. But I can tell you that the infection in your leg is spreading faster than it should. Your cardiac history narrows our options if things escalate. And you've been sitting on this for a week, which means we don't have a lot of room to spare. She met his eyes. So I'm asking you to let me do my job. Raymond Voss looked at her for a long moment. The ceiling was behind her, and he shifted his gaze to it, the habit she hadn't identified yet as his processing position. You're very certain of yourself, he said, for someone in scrubs. I'm certain of what I can see, she said. That's all I'm claiming. She gathered the used materials into the disposal bag, stripped her gloves, and crossed to the hand-washing station. Behind her, she heard him shift in the bed. Adjustment, not agitation. A small settling. She noted it without drawing attention to it. When she turned back, his arms were crossed and his eyes were on the ceiling, but he wasn't reaching for the call button and he wasn't telling her to leave. Given where the morning had started, that was something. Quote, by 9:30, the situation had changed in the way that bad medical situations tended to. Slowly enough that you could almost talk yourself out of worrying, and then all at once. The attending physician on Voss's case was Dr. Perry Anslin, a hospitalist who had been at Hargrove General for 11 years and carried the particular weariness of a man who had seen enough that very little surprised him anymore. He reviewed the morning labs standing in the hallway outside 318, and when he finished, his expression did the specific thing that physician expressions did when the numbers were going the wrong direction. White count is higher than last night, he told Claire. Inflammatory markers are climbing. CRP is up almost 40% from the admit labs. He lowered the tablet. We need to talk about escalating the antibiotic protocol, but he's already refused an infectious disease consult once. When? The overnight attending tried to get ID involved around 4 this morning. He told them he didn't want more doctors in his room, didn't want more people touching him, didn't want... Anslin paused. He expressed his preference with considerable clarity. I'll talk to him about it. Anslin looked at her with the expression of someone who had run out of ways to try. He was a battalion commander, decorated. He spent nearly 3 decades being the person who decided things and directed people and didn't answer to anyone below his pay grade. A pause. In his head, that's still the situation. I understand. Good luck, he said, and walked away without much conviction behind it. She went back in. Voss had gotten himself upright, more than he'd managed at 6:50. He had the television on, news with the volume low, and he was eating his way through the breakfast tray with the aggressive disinterest of a man who resented needing to eat in a place like this. He looked up when she entered. Labs, she said before he could. Your infection numbers are going up since last night. I heard. The resident came by. He set down the fork. Said the same thing. Dr. Anslin wants to bring in an infectious disease specialist. It's just a consult. They look at your labs, assess the wound, give the attending guidance on the best antibiotic approach. It's not a complication. It's a tool. I've got enough people in and out of this room. I know. She pulled the chair from the corner. She'd noticed the night nurses always pushed it back, and she always moved it back to his side. And this was the second time she'd done it today. And sat down. Not standing over him, at his level. But your numbers are moving in a direction that means the current approach isn't working fast enough. If we don't get ahead of this, we end up in a much harder conversation later. He looked at her sideways. The television murmured. Outside the third-floor window, Dunmore City was doing the mid-morning thing. Buses, pedestrians, the ordinary texture of a city going about its business, while a man in a hospital bed decided whether to cooperate. Fine, he said. One consult. One. And I decide what happens after that. That's fair, she said, and meant it. She was almost to the door when his voice came again, lower, less shaped by habit. You said you understand. A pause. What do you know about not wanting people to see you like this? She stopped, turned. He was looking at the wall, not at her. His jaw was set, but it wasn't armor now. It was the face of a man working at something. More than you'd probably expect, she said. She left it there and went to call the infectious disease team. Dr. Sylvia Morrow arrived for the consult at 11 and spent 9 minutes in the room before coming out to find Claire at the nursing station. Morrow was the kind of physician who delivered bad news the way you pulled a bandage, straight and quick, because dragging it out didn't help anyone. He told me my credentials were impressive for a civilian, Morrow said, pulling up his imaging on the station terminal. He also told me the infection wasn't as serious as everyone was making it, and he dealt with worse in the field. She didn't look up from the screen. He's wrong about both things. What are you seeing? I want to change his antibiotic protocol, and I want imaging of both legs, full imaging. She turned the screen toward Claire. There's a section on his right calf that concerns me. The way the inflammation is tracking, the way the margins look, I want to see what's happening underneath. What are you thinking it is? Morrow was quiet for a moment. I'm thinking I want to confirm or rule out early necrotizing changes before I say the word out loud. She kept her tone flat and clinical, but Claire had worked alongside physicians long enough to read what sat under flat and clinical. If I'm right, we're not talking about antibiotic adjustments anymore. Surgery? Possibly. Morrow looked at her. I've been told he communicates with you better than anyone else who's gone into that room today. That's not a very high bar. The other two didn't stay long. Still, he's going to push back on the imaging. I need him to say yes. She handed Claire a printed summary of her recommendations. Can you get him there? Claire looked at the summary. The language was careful and hedged, the specific kind of medical hedging that existed to protect against certainty, but that she'd learned to read past years ago. What it said underneath the hedging was, "This is moving fast and we're not ahead of it." "I'll try," she said. Back in 318, Voss had clicked the television off and was doing the ceiling thing again. She came in and sat down without preamble, setting the imaging request form on the tray table between them. He glanced at it. "What is that?" "Imaging request for both legs. Dr. Morrow wants a clearer picture of what's happening in the tissue. I had imaging last night. This is different, more detailed." She kept her voice even. She wants to see beneath the surface. The overnight imaging was a snapshot. This is a closer look at the specific area she's concerned about. "What area?" "Your right calf." He looked at the form without touching it. "What does she think is happening?" She held his gaze. He had asked the question directly, and she owed him the same. "She thinks the infection may be causing some of the tissue to break down. She wants to confirm it or rule it out before she tells you more." A beat. If she confirms it, the conversation changes. Changes how? "Surgery." The word landed in the room and stayed there. She watched him process it. Raymond Voss, decorated, command experienced, a man who had navigated situations where wrong decisions had body counts, was sitting with the particular stillness of someone who had just had the ground shift under them and was calculating how fast it was moving. His hands were on the bed rail. His knuckles were white. "How sure is she?" he said. His voice was lower now. Not sure enough to say it without the imaging. That's why she wants it. She leaned forward slightly. "I know what you're thinking. You're thinking if you agree to the imaging and it confirms what she suspects, you lose control of the next step. That things start moving in directions you didn't choose." She paused. "But you don't get control back by refusing to look. You just get surprised later." Something in his expression changed. Not enough that anyone who didn't know how to read people would catch it. But she caught it. "All right," he said. "Imaging." "Thank you." She reached for the form. "Merritt." She stopped. "You're not like the others." He said it like he was still deciding how to file the information. "The others wanted me to cooperate so I'd stop being a problem for them." "That's probably true," she said. "That's not what you want." "No." She tucked the form under her arm. "I want you to be alive in a week. That's the whole list." She went to schedule the imaging before he could complicate it. Radiology turned the results around in under an hour, which was the kind of speed that meant the images had been flagged as urgent the moment the radiologist saw them. Claire was halfway through a medication pass when Morrow appeared at the end of the hallway with the expression of someone who had been right about something and wasn't glad about it. "Necrotizing fasciitis," Morrow said, keeping her voice low. "Right leg, medial calf, confirmed. The left shows early involvement, but it's significantly less advanced." She had her tablet with the imaging open, and Claire looked at it, the white and gray architecture of tissue and bone, and in the center of the right calf, a dark, irregular bloom that marked the place where living tissue was becoming something else. "He needs surgery today, within the next few hours. This doesn't wait. Does Anslin know?" "I'm on my way to him now." She closed the tablet. "But Voss needs to know first, and it needs to come from someone he'll actually hear." A pause. "That's you. I know that's not a fair ask." "I understand. If he refuses—" Morrow stopped, chose the words. "If he refuses the surgery, the infection continues to spread. The tissue loss expands. We are already talking about significant damage to the right calf. If it reaches the fascia on the thigh—" She didn't finish the sentence. "Don't let him refuse." Claire walked back to 318 for the fourth time that day. Voss looked at her face when she came in the door, and the armor came up immediately. Jaw tight, posture shifting, the full assembled performance of a man who had decided in advance that he wasn't going to be afraid of whatever was coming. He had read her expression the same way she read his. Different training, same instinct. She sat in the chair, moved it close. "The imaging confirmed what Dr. Morrow was concerned about," she said. "The infection in your right leg is causing the tissue to break down. This type of infection, the medical term is necrotizing fasciitis, Moves faster than antibiotics can treat. The only way to stop it spreading further is surgery. They go in, remove the affected tissue, create clean margins. It's called debridement. He said nothing. It needs to happen today, she said, within the next few hours. Still nothing. His hands were on the rail. If you don't have the surgery, the infection keeps moving. We've already confirmed tissue involvement in the right calf. If it spreads to the fascia on the thigh, she stopped. Let him hear the silence. That's a conversation I don't want to have with you tomorrow, so I'm having this one now. How much? He said. His voice was stripped down to its frame. No performance left in it. How much are they going to take? They won't know exactly until they're in. They'll take what they have to take to stop it, and they'll preserve as much as possible. She held his gaze. But you need to go in knowing they may not be able to save everything. The room was very quiet. Raymond Voss turned his head and looked at the window. Outside, Dunmore City was moving through the middle of its Tuesday afternoon without knowing or caring what was happening in room 318. His jaw was working, not with anger, not with the performance of authority, with something older and harder to name, the effort of a man absorbing something that couldn't be pushed through. I've sent soldiers into situations where they didn't come home whole, he said. Each word was careful, placed deliberately, the way you placed weight on uncertain ground. I've sat across from families. I've said the words. A pause. I thought I understood what that cost. She didn't say anything. I was wrong, he said. She looked at him. She thought about saying something, about what she knew, about what she'd seen, about the things she carried from years that had nothing to do with this hospital or this city. She decided not to. Not yet. This moment belonged to him. Sign the consent form, she said quietly. Let them fix what can be fixed. He turned from the window. Raymond Voss, for the first time all day, looked like exactly what he was. A 61-year-old man in a hospital gown, sick and scared and out of road to push through. He held out his hand. She gave him the form and the pen. He signed without reading it. The same way, she imagined, men signed things in the field when the situation had already told you everything the paperwork was going to say, and there was no time for the fine print. He handed it back. Merritt. Yes. You'd better be here when I get out. She folded the form, stood. I'll be here, she said. The orderlies came 40 minutes later. She stood at the nursing station and watched the bed roll past and around the corner toward the elevator. And then the hallway was empty and Deborah Falk was beside her with a mug of something that had been sitting too long. He signed? He signed. Deborah exhaled slowly. How? I told him the truth. Claire picked up her medication pass list. He's not afraid of hard information. He's afraid of being handled. Deborah looked at her with the expression of someone assembling a picture from pieces that didn't quite fit the frame they'd been given. You know, she said, careful, the way you worked with him today, it's not like watching someone manage a difficult patient. He's not easy. It took most of the day. That's not what I mean. Deborah turned her mug in her hands. It's like you know that room. Not a hospital room, as a different kind of room. The kind where you can't show anything and you can't leave and you have to find a way through anyway. She paused. Like you've been in that room before. Claire looked down the empty hallway toward the elevator. I should finish my med pass, she said. Deborah didn't push. She had been doing this long enough to know which doors were meant to stay closed. E. The surgery lasted 4 hours and 12 minutes. Claire's shift ended at 3. She stayed. She told herself it was continuity of care, that handing off mid-surgical case to an incoming nurse who hadn't been in that room all day was bad practice, and that was true. She didn't think too carefully about the rest of it. At 6:20, one of the surgical floor nurses found her in the third-floor break room, staring at a cup of coffee she hadn't touched. He's out, the nurse said. Recovery's going to take a while. They had to. It was more extensive than they hoped going in. They took tissue from the medial and posterior calf on the right. A pause. But the leg is there. Okay. She let out a breath she hadn't realized she was holding. Thank you. The nurse left, and Claire stood at the break room window for a moment with her hand flat against the glass. Dunmore City was going dark outside, The sky that particular orange-gray of a summer evening in a mid-sized American city. Not beautiful, not dramatic, just real. The kind of sky you noticed after a long day indoors. Her phone buzzed. She looked at the screen. A number she hadn't seen in almost 2 years. No name attached to it. She'd never saved it under a name. Just the single letter T entered years ago when she'd thought she might need it and then hoped she never would. 3 words in the message. "We heard you're there." She read it twice, put the phone in her pocket, went back to the floor. At 9:45, they wheeled Raymond Voss into his step-down room. He was heavy with anesthesia, pale from blood loss, his eyes at half-mast and struggling to come all the way up. But when the bed stopped moving and his eyes registered her face in the doorway, something in them shifted, a small focusing, like a lens finding its mark. "Still here," he said. His voice was rough and slow, stripped of everything except the fact of it. "Still here," she said. "How bad?" She came to the side of the bed. "They got it, both legs. The infection is out." She kept her voice steady and factual, because that was what he needed and what she was capable of. "The right calf is going to need time. There will be follow-up procedures, physical therapy, a long road. It's not going to be simple or fast." She paused. "But the leg is there." He closed his eyes, opened them again, slower. "The leg is there," he said, like he was placing the fact somewhere he could find it. "Yes." A long silence. The monitors beeped. The room smelled like post-surgical antiseptic and the faint metallic trace of the OR that always came back with patients. "Thank you," he said. 2 words. She heard what they contained, not just the surface of them, not just gratitude for the surgery or the shift she'd stayed through. Something longer than that. Something that had to do with a form signed in a moment of real fear and a door that had been shut for a long time finally coming open. "You're welcome," she said. She finished her notes at the nursing station, said goodnight to the night crew, took the elevator down. In the lobby, she got her coat from the locker and pushed through the front door into the night air. At the bottom of the hospital steps, she stopped, took out her phone, read the message again. "We heard you're there." 3 words, no punctuation, no explanation. They didn't need any. Whoever had sent them knew exactly what they meant, and so did she. She stood on the sidewalk in the Dunmore City night. The hospital lit up behind her, the street going quiet the way streets did on a Tuesday past 9 o'clock, in a city that wasn't quite big enough to stay loud past dark. She typed 2 words back. "I know." Put the phone in her coat pocket. Walked toward the parking structure with the particular steadiness of someone who had spent a long time learning how to carry things without showing the weight. Nobody who passed her would have looked twice. Just a nurse, end of shift, heading home. That was exactly what she needed them to see. She didn't sleep well. That wasn't new. Sleep had been a negotiation for years, something she had to approach sideways without looking directly at it, because the moment she tried too hard, it disappeared entirely. She had methods, a specific order of things: shower, tea, the window open exactly 2 inches, the television on low with something boring and not the news. It worked most nights. It didn't work that night. She lay in the dark of her apartment on Caldwell Street and looked at the ceiling and thought about the text message and what it meant that someone had found her after nearly 2 years of quiet. "We heard you're there." Simple enough on its surface. Underneath it, a whole geography she had spent a long time walking away from. She got up at 4:30 and made coffee and stood at the kitchen window watching Dunmore City do the thing it did before dawn. The delivery trucks, the street cleaners, the particular loneliness of a city between its night self and its day self. She had lived in 3 cities since leaving the service. This was the 3rd. Each one she had chosen for the same reasons. Mid-sized, not famous for anything, the kind of place where a person could build a life that didn't ask too many questions about the one that came before it. She thought about Raymond Voss in his step-down room. The leg was there. The infection was out. He had a long road ahead of him, and he was going to be difficult about most of it, and that was fine. Difficult she could work with. Difficult she understood. She thought about the letter T on her phone screen and the 2 words she had sent back, and whether that had been the right call. She drank her coffee and decided she didn't know. She went to work. The shift change at Hargrove General happened at 7, and by 7:10 Claire was in 318. Now Voss's step-down room, repositioned to a quieter section of the floor overnight, checking his chart on the wall terminal while he watched her from the bed with the particular alertness of a man who had slept badly and didn't want anyone to know it. His color was better than last night. Not good, but better. The fever had come down 2 degrees. His pressure was holding in a range that Anselin had described in the margin of his notes as acceptable for now, which was hospitalist language for "we're not celebrating yet." "How's the pain?" she asked. "Managed?" "Scale." "I don't do scales." 7, 8. A pause. 6. "I'll get the attending to review your pain protocol. 6 is too high for where you are post-op." She made the note. "Did you sleep?" "Some." She looked at him. He looked at her. "No," he said. "Okay." She moved to check the surgical dressing on his right leg, layered, immobilized, the kind of post-debridement wrap that was less about the wound and more about keeping everything still while the margins began to figure out what they were now. "The surgical team will be in on rounds between 8 and 9. Dr. Morrow wants to follow up on the left leg. The imaging showed early involvement there, and she's going to want to assess how it's responding to the new antibiotic protocol." "How bad is the left one?" "Significantly less advanced than the right was." "That's the honest answer." She smoothed the edge of the dressing tape. "Whether it stays that way depends on how the antibiotics work over the next 48 hours. He absorbed that without comment. Then, "You stayed last night." "My shift ran long." "Don't do that." His voice was flat. Not angry, just tired of things being soft-pedaled. "I saw the time when they brought me up from recovery. It was past 9. Your shift ended at 3. She didn't say anything. "Why?" he said. She finished with the dressing and stripped her gloves. "Because handing off mid-case to an incoming nurse who hadn't been in this room all day would have been bad practice." She looked at him. "And because I told you I'd be here." He held her gaze for a moment. Something moved through his expression. Not gratitude exactly, more like recognition. The look of a person who has been surprised by someone and is still in the process of adjusting to it. "I don't remember much from recovery," he said. "That's normal." "I remember your face." A pause. "That's it? Just your face when they brought me in." He looked at the window. 30 years in the Army, I've been through field surgery. I've been blown sideways by a concussive blast that ruptured my eardrum and cracked 2 ribs. And I've sat up in a field dressing station and gone straight back out. He was quiet for a moment. "Yesterday was the most scared I've been in a long time." She sat down in the chair. "I know." "Not of dying," he said. "I'm not afraid of dying. I've made my peace with that particular possibility." He turned back from the window. "Of not being, of being less, of being the kind of man who needs someone to push him around in a chair." "That might still happen for a while," she said. "The chair part." He made a sound that wasn't quite a laugh. "Yeah." "Then, you could have lied." "I could have." "Most people would have." "I know." She picked up the tablet. "I'll get Anselin to review the pain medication. Try to eat something when they bring breakfast. Your body needs the calories right now, and not wanting to eat doesn't change that." She stood. He watched her move toward the door. "Merritt." She stopped. The 3rd time this morning. She was beginning to recognize it as a pattern. He talked to the room, and then, when she was almost gone, he said the thing he'd actually wanted to say. "You said yesterday that you knew what it was like," he said, "not wanting people to see you when you're down." She turned halfway, said nothing. "I've been thinking about that," he said. "All night." She waited. "I've been here 4 days," he said. "You're the only person who's talked to me like I was still the same person." He paused. "Not a patient, not a problem to be managed, the same person." She looked at him, thought again about saying something more, about the territory that sentence was grazing the edge of. "Get some rest," she said. "I'll be back after rounds." She went out before the moment could turn into something neither of them was ready for. Amen. Rounds were at 8:15. Anselin came with his surgical fellow, a young woman named Dr. Okafor, who had the clipped efficiency of someone 3 years into a residency and still running on the adrenaline of actually getting to do the things she'd trained for. Morrow was there too, reviewing overnight labs on her tablet before she'd even cleared the doorway. Claire stood at the back, which was where nurses stood during physician rounds. Present, listening, invisible, unless someone needed something from them. The conversation started clinically enough. Overnight vitals, pain assessment, surgical site status. Okafor reviewed the debridement margins. Morrow pulled up the left leg imaging. Anslin made notes in the chart. Then Voss said, "When do I go home?" The question landed in the room, and all three physicians looked at him with variations of the same expression. "Colonel Voss," Anslin said, patient and precise, "you had major surgery yesterday for a necrotizing soft tissue infection. You're 20 hours post-op. We're still managing active infection in your left leg and monitoring for recurrence in the right. I understand my condition." Voss's voice had returned to its operational register, measured, authoritative, the voice of someone used to driving a room. "I'm asking when I go home." "That's going to be a minimum of a week," Morrow said. She said it the way she said everything, without hedging, without apology, without opening a negotiation. "Possibly 2. We need to confirm the left leg is responding to antibiotics before we even begin discussing discharge. And when you do go home, you'll need wound care, IV antibiotics for a period, and physical therapy to start addressing the muscle and tissue loss in the right calf." "I have a house," Voss said. "I can arrange my own—" "You live alone," Okafor said. Then caught herself, because that had come out faster than was probably professional. She was young enough that she still had moments like that. "The intake form," it said. "I know what it said." He looked at the ceiling. "Fine. The other thing we need to discuss," Anslin said, moving forward because he'd learned that moving forward was the best strategy in rooms like this, "is the cardiac component. Your pressure was irregular overnight. Nothing that required intervention, but your cardiologist is going to want to be involved before we talk about discharge, and I want to be transparent about that." Voss was quiet. "Is there someone we can contact?" Anslin asked. "Family, someone who could be here during this—" "No." The word was flat and complete, and nobody pushed it. Claire, at the back of the room, made a note in her tablet. Not a clinical note. A different kind of note. The kind you made about people. The kind that didn't go in the chart. Rounds ended at 9:10. The physicians left. Claire stayed behind to adjust his monitoring leads, which had shifted overnight. He let her work without comment, which was different from yesterday's version of him, and she knew it. Outside in the hallway, the floor had hit its mid-morning rhythm. The particular controlled chaos of a ward past the crisis hours and into the maintenance stretch. Call buttons, IV alarms, the squeak of the medication cart, the low, steady overlay of a hospital doing what hospitals did. She was almost finished with the leads when Deborah Falk appeared in the doorway, and the expression on her face was the kind that didn't get used for routine things. "Can I borrow you for a second?" Deborah said. It wasn't phrased as a question. Claire glanced at Voss. He had the ceiling again. She stepped out. Deborah walked her 3 doors down the hallway before speaking. "I got a call this morning. About you." Claire waited. "From hospital administration." Deborah kept her voice low and even, which was a skill and also a tell. She used that particular evenness when she was managing her own reaction to something. "Dr. Harlan Price, do you know who that is?" "Chief of Clinical Operations." "Right." Deborah folded her arms. "He called me at 6:50 this morning, which is before my coffee and before God, and he wanted to know about your interaction with Colonel Voss yesterday." "What about it?" "He wanted to know whether you exceeded your scope of practice, whether you made clinical decisions without physician oversight, whether you—" Deborah stopped, pressed her lips together. He used the phrase coerced patient consent. The hallway felt smaller. "He said the surgical team filed a note expressing concern that the patient signed the consent form without fully understanding the implications," Deborah continued. "He said they believed there may have been undue pressure applied by nursing staff." "I told him the truth," Claire said, "about the infection, about what happens if he doesn't have the surgery. I know that. I didn't make any clinical determination. Every word I said to him was based on information from Morrow and Anslin." "Claire," Deborah's voice was steady, "I know. I believe you. I'm not—" She stopped again. Reset. "I'm telling you because Price asked me to file a formal incident report by end of day." Silence. "He's requesting you be moved off Voss's case immediately," Deborah said. Pending review. Claire looked at the floor. A moment. Then, who filed the note with the surgical team? Deborah hesitated one beat too long. The concern was raised by the surgical fellow, Dr. Okafor. Okafor was in rounds for 15 minutes this morning. She wasn't there yesterday. I know. She based a formal concern on Claire. Deborah's voice dropped further. It didn't start with Okafor. Okafor signed her name to it. The concern was, it came from higher up than that. Price had the note before it was filed through normal channels, which means somebody went to him first. She looked at her directly. Somebody who wanted this on record before rounds were even done. Why? Claire said. It was a real question, not rhetorical, not angry. She actually wanted to understand the shape of it. Deborah's expression said she had theories and wasn't ready to say them out loud. The colonel has a history with this hospital. He's been a patient here 3 times in the past 4 years, and each time there have been complaints about his conduct. Staff have filed HR reports. There are people in administration who have been trying to build a case for restricting his access to certain facilities. A pause. And then you walk in and get him to cooperate in a single day. That's not... I know it doesn't make sense on the surface, Deborah said. I'm just telling you what I see. Someone is uncomfortable with how yesterday went, and they're using the consent process as the lever. She unfolded her arms. I need to file the report. I don't have a choice in that, but before I do, I need to know, is there anything about yesterday that I should know? Anything that could come back as a problem? Claire thought about it honestly. Ran the day back through in her head. The conversations, the decisions, the moments she'd pushed, and the moments she'd pulled back. No, she said. Nothing. Deborah looked at her for a long moment, then nodded. Okay. Am I being moved off his case? Another pause. Price asked for it. I have until end of day to respond. She started walking back toward the station. I haven't responded yet. By 11 o'clock, Raymond Voss knew something was wrong. He didn't ask her directly. That wasn't how he operated. Instead, he watched her with the particular attention of someone trained to read situations by reading people. And when she came in to check his mid-morning vitals, he said, without preamble, "Who's giving you trouble?" She looked up from the monitor. I'm not sure what you mean. You've been in twice this morning, and both times you're carrying something that wasn't there yesterday. He said it flat, not unkind. I've read people for 30 years. Don't try to manage me. She finished the vitals, sat down in the chair because standing while telling someone something difficult was always the wrong choice, and she knew it. There's a concern that's been raised, she said, about the way I handled the consent conversation with you yesterday, before the surgery. He stared at her. What kind of concern? That you may not have fully understood what you were agreeing to. That there may have been inappropriate pressure applied. The silence that followed was the kind that had edges. Who raised it? He said. I can't tell you that. Can't or won't. Both. She met his eyes. It's being reviewed. That's all I know right now. Raymond Voss's expression went through several things in quick succession. She watched them move across his face, the way weather moved across open ground. First disbelief, then recognition. Then something she hadn't seen from him yet, a cold, focused anger that was entirely different from the hot performance of yesterday morning. This was the other kind, the kind that didn't throw trays. You're being punished, he said, for keeping me alive. That's not established. There's a process. Don't, he said it quietly. Don't do the thing where you tell me the system works. I've been in enough systems to know what it looks like when someone's using the process as the weapon. He pushed himself upright against the pillows. Too fast. She could see it cost him, but he wasn't going to let it show. Tell me what you need. I don't need anything from you. You need someone to say what actually happened in this room yesterday. Colonel Voss, my name is Raymond. He said it like a decision. And I'm the patient who signed the consent form. If someone is questioning the circumstances of that consent, I am the person who can answer that question. He looked at her steadily. Whatever you need me to say, I will say it, because you didn't pressure me into anything. You told me the truth and let me decide. A pause. Nobody has done that in a very long time. She looked at him. The anger in him was real and it was clean. Not the defensive anger of yesterday, not the armor. Something more like the anger of a person who recognized an injustice and had enough left in him to care about it. "I'll let you know if something comes up that requires a statement," she said carefully. "You'll let me know today," he said. Not a request. She stood. "I'll let you know today, Chad." At 12:40, Deborah appeared at the nursing station with the expression of someone who had made a phone call she hadn't wanted to make. "I pushed back on the removal," she said. "I told Price I needed documentation of a specific violation before I reassigned a nurse mid-case. He said the concern about patient consent was documentation enough." She set a printed form on the desk between them. "He's making it official. You're off Voss's case starting tomorrow morning." Claire looked at the form. "I'm sorry," Deborah said. And she meant it. That was clear. She wasn't the kind of person who said things she didn't mean. "Who does he go to?" "Night crew will cover tonight. Davis is available tomorrow." Davis has never dealt with a patient like this. "I know." Deborah's voice was tight. "I know that, Claire. My hands are tied." Claire picked up the form. "Read it." Price's name was at the bottom, signature firm and practiced. Above it, the language of institutional bureaucracy, pending review of nursing conduct. Best interests of patient care continuity. Administrative discretion. The words that meant nothing and covered everything. "Is there a formal complaint process?" she asked. "There's always a formal complaint process," Deborah said. "HR, patient advocacy, the nursing board if it goes that far. But Price is 3 levels above me in the org chart. Filing against him." She stopped. "I'm not saying don't. I'm saying be prepared for what comes with it." Claire set the form back on the desk. "Can I finish today's shift on his case?" "Yes. He didn't mandate immediate removal." "Then I'll finish today," she said. She went back to 318. She told him. She did it at 1:15, after his lunch tray had come and gone mostly uneaten, and after she'd checked his afternoon labs, which showed the left leg infection trending in a direction that Morrow, when she'd reviewed them at noon, had called cautiously promising, the kind of description that meant things were moving the right direction without being willing to declare victory. She sat in the chair. Said it plainly. She was being removed from his case, administrative decision, effective tomorrow morning. He listened without interrupting. When she finished, his face did the same thing it had done that morning. That sequence of weather moving through. "Because of the consent question," he said. "That's the stated reason. And the real reason." She didn't answer that. "I want to file a statement," he said. "Today. Whatever form, whatever process. I want it on record that I understood exactly what I was agreeing to, that I was given accurate information and allowed to make my own choice, and that the nurse who gave me that information is the reason I still have my leg." He looked at her. "Tell me who to call." "You can request patient advocacy through the front desk. They're in the building." "Get me a phone." She handed him the bedside handset without comment. He called the front desk, asked for patient advocacy, was told there was a callback wait of up to 4 hours. He took the callback number without losing the particular quality in his voice that said he would wait exactly as long as he needed to and not 1 second longer. When he hung up, he looked at her. 4 hours is fine, he said. "I've waited longer for worse things." She nodded, started to stand. "Merritt." She waited. "Sit down," he said. "Just sit, for a minute." He looked slightly embarrassed by the request, which was a new expression on him, and she found it unexpectedly human. "I've been in this room for 2 days talking to physicians who look at my chart, and nurses who look at their shoes, and one orderly who barely speaks. You're the only person who talks to me like a person." A pause. "Sit. For a minute." She sat. "Tell me something," he said. "Not about my legs." She looked at him. "What do you want to know? How long have you been a nurse?" 7 years. "And before that?" She was quiet for a moment. It was a careful quiet, not evasive, not performing, the kind of quiet that was measuring something. "Other things," she said. He looked at her. His eyes had the particular quality of someone who spent decades reading people in rooms where misreading them had consequences. He wasn't going to push, but he was also clearly not satisfied. "The way you are in here," he said slowly, "the way you work. It's not most nurses, even good ones. There's a process to it. They're managing you. You're not managing me. He tilted his head slightly. You're reading me. The way you read a situation, not a patient. She looked at him. I've seen that one other place, he said. In people who've been somewhere. Done something that changes the way you move through a room. She picked up the tablet that was sitting on the tray table, opened his afternoon medication schedule. Your 2 o'clock meds are coming up. I'll get them from the dispensary. Merritt. She looked at him. What was your MOS, he said. Military Occupational Specialty. The specific language of the armed forces, not something a civilian nurse would know the abbreviation for, not something you'd use automatically. The tablet was still in her hands. He had noticed. She could see that he had noticed, the small stillness that came over him, the focused attention of a man who had just gotten confirmation of something he'd been circling for 2 days. I'll get your medications, she said. She went out. In the hallway, she stood with her back against the wall for a moment and breathed. Not from fear. Fear wasn't quite the right word for what this was. More like the particular feeling of something you've been keeping in a specific place starting to move. Her phone buzzed. The same number. The letter T. This time, not 3 words. 5. We need to talk. Tonight. Please. She read it twice. Put the phone away. Went to the dispensary. For what? The afternoon passed in the specific way that hospital afternoons passed when you were trying not to think about something. In increments, in tasks, in the small mechanical actions of a job that gave you somewhere to put your hands. She gave Voss his 2 o'clock medications. He took them without comment. He didn't ask again about the MOS. He didn't push. He had made the observation and put it on the table and was apparently willing to wait for her to decide what to do with it, which was, she thought, one of the more sophisticated things a person had done in a conversation with her in a long time. At 3:30, patient advocacy called him back. She wasn't in the room when the call happened. She was 3 doors down, helping Davis get familiar with the other cases on the assignment for tomorrow, walking him through the charts with the particular care of someone who was trying to make sure the work she'd done didn't get lost in the handoff. Davis was competent. She wanted to be honest about that in her own head, because she had a tendency when she was frustrated to underestimate people she didn't want stepping in. He was competent. He just didn't know Voss. Nobody was going to know Voss the way she did after yesterday, and that was simply the truth. At 4 o'clock, she went back to 318. Voss was off the phone. He was sitting up straighter than he had been all day, and there was something different in the room, a charge to the air that hadn't been there before. He looked at her when she came in with the expression of a man who had just had a productive conversation. Patient advocacy is filing a formal response to the administrative action against you, he said. I gave a full statement, detailed. I told them what was said, the sequence, the fact that I was given accurate medical information and exercised my own judgment, and that the characterization of that conversation as coercive is, he paused, chose the word, inaccurate. You didn't have to do that. I'm aware. He looked at her steadily. I also told them that I'm a retired Army colonel with 30 years of command experience, that I have contacts at the regional VA office and the state health department, and that if this action moves forward against a nurse whose only professional failure was telling me the truth, I will be making a significant number of phone calls. She looked at him. Is that a problem? He said. I don't know yet, she said honestly. Good answer. He leaned back against the pillows. Something in his posture had changed, not relaxed, but settled, like a man who had found something to push against and was relieved to be pushing. I've spent 2 days lying in this bed feeling useless. This I can do. She checked his pressure, which was better than this morning, checked the surgical dressing, which was holding, made her notes. At the door, she stopped. Raymond, she said. He looked up. It was the first time she'd used his name. Thank you, she said. He nodded once, precise. Military. Don't let them move you off my case without a fight, he said. She went out. She left the hospital at 5:45. The day had been long in the way days were long when they carried a lot, not in hours exactly, but in the accumulated weight of the things that happened inside them. She walked to her car through the parking structure and sat in it for a moment without starting the engine. Took out her phone, opened the text thread with the letter T, typed, Where? The response came in under a minute. Kellerman's, 7 p.m. I'll be in the back. She recognized the name. a bar and grill on Pendleton Avenue, the kind of place that had been there for decades and smelled like it, the kind of place where nobody paid attention to who sat in the back. She had walked past it twice since moving to Dunmore City. She had not gone in. She sat in the parking structure and looked at her phone and made a decision she'd been avoiding for 2 years. "I'll be there," she typed. She started the car and drove home. Kellerman's at 7 on a Wednesday was half full. Bar crowd on one side, a scattering of dinner tables in the middle, and a row of booths along the back wall in a section that got less light than the rest of the room. She walked straight to the back without stopping at the bar. She'd worn the same clothes she'd changed into after her shift. Dark jeans, a gray jacket, nothing memorable. The man in the last booth saw her coming. He stood when she got to the table. Mid-40s, not tall, the build of someone who had once been extremely fit and still mostly was, with the addition of years and weather. His hair had gone gray at the temples. His eyes were the same as she remembered, pale brown, steady, always slightly ahead of the conversation. Thomas Garrett. She had known him for 11 years. She had not seen him in 22 months. "Claire," he said. "Sit down, Tom." They sat across from each other. A waitress appeared, and Garrett ordered 2 coffees without asking, which was both presumptuous and accurate. Claire let it go. "You look good," he said. "You look tired," she said. "What's going on?" He wrapped his hands around his water glass. He had a way of doing that, holding things in a specific way, anchoring himself to the table, that she'd noticed years ago and had been told once was a self-regulation habit he'd picked up after coming back from his 3rd deployment. She'd never mentioned that she'd noticed. "There's a situation," he said. "There's always a situation with you. This one's different." He glanced at the room. Old habit. "You've heard of Operation Callaway," she thought. The name was familiar in the distant way that things became familiar when you'd been out of a world for a while. Echoes of it, not the shape. Vaguely. It was a joint special operations mission, roughly 12 years ago, multi-theater. The details aren't what matters right now. He looked at her. What matters is that there were records. After-action reports, medical records from deployed personnel, incident documentation, records that were mishandled, misfiled, and then, about 8 years ago, deliberately altered. The coffee arrived. She didn't touch hers. "Altered how?" she said. "Casualty attribution? Who did what in which engagements? Who received credit? Who received blame?" He turned his mug in his hands. "A number of personnel who performed under extreme conditions, including several medical personnel, had their records changed, commendations removed, incidents attributed to them that didn't happen the way the records say." He paused. "Or at all." She looked at him steadily. "There's a federal investigation," he said. "JAG and CID jointly. They've been building it for about 1.5 years. They're getting close to something formal." Another pause. "Your name has come up." She said nothing. "Your records from the period in question," he said carefully. "They're not what they should be." The bar noise continued around them. The ordinary texture of people having ordinary evenings. She was aware of it the way you became aware of weather, as a backdrop, something you were separate from. "What does that mean?" she said. "It means that what's in the official record about your service during Callaway doesn't match what several witnesses have said to investigators." He held her gaze. "It means that someone, at some point, changed what happened." He leaned forward slightly. "Claire, you were there. You know what you did. And whatever's in that record right now, it's not that." She picked up the coffee cup, held it, put it down. "Why are you telling me this here?" she said. "Like this. Because the investigators are going to come to you," he said. "Officially. Probably within the next 2 weeks. And I wanted you to know before they showed up at your door." He paused. "Or at Hargrove General." The name of the hospital landed between them. She looked at him. He looked back. Something was happening behind his eyes. Not quite guilt. The near relative of guilt. The expression of someone carrying information they should have delivered sooner and knew it. "You've known I was here for longer than 2 days," she said. It wasn't a question. He didn't answer, which was an answer. "How long?" she said. A pause. 6 weeks. The bar noise continued. The coffee cooled. I needed to make sure the situation was stable before I made contact, he said. The investigation is at a sensitive point, and I didn't want to bring attention to your location before 6 weeks, she said again. He stopped talking, looked at the table. Tom, her voice was quiet and very controlled. Whatever you came here to tell me tonight, say it, all of it, right now. He looked up. There's a name, he said. One name attached to the records alteration. It took them 18 months to find it, and they found it 3 weeks ago. He paused. The investigator called me last Friday. He wanted to know if I had a way to reach you. She waited. The name, Garrett said, is Colonel Raymond Voss. The booth was very still. Outside on Pendleton Avenue, a truck went past with its engine loud and then faded. The bar noise continued, indifferent. Claire sat across from Thomas Garrett and looked at the name hanging in the air between them and felt the specific sensation of a floor she had thought was solid, beginning to show its fault lines. He's a patient, she said. I know. He's been in my care for 2 days. I know that too. Garrett's voice was careful. I found out yesterday, when the hospital reported his admission to the VA system. You've been watching for his name. The investigators have. He held her gaze. Claire, I need you to understand what I'm telling you. The man in room 318 of Hargrove General may be the person who rewrote your history, who took what you did in that deployment and buried it. A pause. And you saved his life yesterday. She looked at her coffee. The surface of it was perfectly still. Her hands, resting on the table, were also still. Were always still. She thought about Raymond Voss signing that consent form without reading it. She thought about the expression on his face when she'd told him the leg was there. She thought about him on the phone with patient advocacy, making a statement on her behalf, the careful anger of a man who recognized an injustice. She thought about what it meant if all of that was the same person. She thought about the 12 years in between. What do the investigators need from me? She said. Garrett reached into the inside pocket of his jacket and placed a business card on the table between them. A name and a number, plain type, government issue. A conversation, he said. When you're ready. She looked at the card, picked it up, turned it over in her fingers. I'll need to think, she said. I know. Don't call me again tonight. Okay. She stood, put the card in her jacket pocket, left the coffee where it was. She walked out of Kellerman's and into the Dunmore City night without looking back, and the card in her pocket was the weight of everything she'd spent 2 years walking away from, returning to find her exactly where she was. 3 blocks from a hospital where a man who might have taken her past from her was lying in a step-down room because she had spent a day keeping him alive. She stood at the corner of Pendleton and 4th and looked at the traffic light cycling green to yellow to red. Nobody passing looked at her twice. Just a woman on a corner, deciding something. The light turned green. She didn't move. A couple walked past her on the sidewalk, close enough that the woman's shoulder nearly brushed hers, and neither of them noticed her standing there. That was fine. That was the point. She had spent years learning how to occupy space without announcing herself in it, and the skill had become so ingrained she didn't think about it anymore. It was just the way she stood in the world. Raymond Voss. She said the name in her head and tried to hold both versions of it at the same time. The man who had thrown a tray at 6:50 in the morning and called patient advocacy at 4 in the afternoon to defend her, and the name that Thomas Garrett had placed on a table in a bar like a grenade with the pin already pulled. The problem was that she couldn't make them fit together, and she was good at making things fit together. It was, in some ways, the central skill of everything she'd ever done. Reading a situation, finding the through line, knowing which pieces were load-bearing and which ones were noise. This one didn't resolve. She walked back to her car. She was at the hospital at 6:45 the next morning, which was 7 minutes earlier than usual, because she had not slept at all, and at 4:30 she had decided that lying in the dark was doing nothing useful. She changed in the locker room, clipped her badge, pulled her hair back. Deborah Falk was at the nursing station when she arrived, and the expression on Deborah's face when she saw Claire said that something had happened between yesterday afternoon and now. Price called me at 6 this morning, Deborah said, without preamble. Again. The patient advocacy office apparently filed a formal objection to your reassignment yesterday afternoon. with documentation. Deborah's voice had that careful evenness again. Price got a call from the patient himself, after hours. I don't know what was said, but this morning Price told me to hold the reassignment pending a meeting. His office, 9 o'clock. A meeting. You, me, him. Patient advocacy rep if they want to send someone. Deborah looked at her steadily. He's not backing down, he's just repositioning. Whatever Voss said to him, it rattled something, but Price doesn't rattle cleanly. He gets careful. Okay, Claire said. Okay, Deborah repeated, like she'd expected a different response and wasn't sure what to do with that one. Are you all right? I'm fine. You don't look fine. You look like you didn't sleep. I'm fine, Claire said again. What's his status this morning? It took Deborah a beat to shift from the question she wanted to ask. Overnight was stable. Fever's down another degree. Left leg inflammation is responding. Morrow reviewed the 4 a.m. labs remotely and updated the antibiotic dosing. His pressure held all night. She paused. He asked the night nurse 3 times what time you came in. Claire picked up the morning assignment sheet. Her name was still on 318. Deborah hadn't reassigned her yet. I'll start with him. He was awake when she came in. Not just awake, sitting up, alert, the television off, with the particular focused stillness of a man who had been thinking for hours and had arrived somewhere. You look terrible, he said. Good morning to you too. She moved to the monitor, checked the overnight readouts. Pressure stable. Heart rate slightly elevated, but within range. How's the pain? 4. That's better than yesterday. Yes. He watched her work. I called Price last night. I heard. I want you to know what I said. He said it in a tone that didn't leave room for her to redirect him. I told him that I am a patient in this hospital who has the right to determine who provides my care. I told him that I chose you, specifically, and that removing you from my case over a process concerned that I, as the patient at the center of that process, am formally disputing is not a decision he gets to make unilaterally. A pause. I also told him that I spent 28 years learning how institutions protect themselves at the expense of the people inside them, and that I could recognize that pattern in my sleep, and that if he moved forward with this action, I would be contacting the State Health Department's Patient Rights Division by end of business. She looked at him. You know the State Health Department. I know people who know people. A small, precise thing that was almost a smile. That's a different skill set, but it gets the same result. She finished the morning vitals review and sat in the chair. There's a meeting at 9. Administration, Deborah, possibly patient advocacy. I know, I asked them to include me. You asked, I'm the patient. I have standing in any meeting about my care. He held her gaze. They said it wasn't standard practice. I said, I didn't care what was standard practice. I would be calling in from this room at 9 o'clock, and if they wanted to hold the meeting without me, they were welcome to try. She looked at him for a long moment. Raymond, she said, I know what you're going to say. You don't. He waited. Thank you, she said, and I need to ask you something, and I need you to answer it honestly. Something shifted in his expression, a wariness under the surface. All right, in the meeting this morning, if Price pushes back hard enough, I need you to let me fight my own case. You've given me tools. The patient advocacy statement, the phone call. That's significant, and I'm not dismissing it. She kept her voice even. But if it gets to a point where you're putting yourself in a position that causes you problems, medical, administrative, anything, I need you to step back. He looked at her. You're 4 days post-surgical onset, she said. Your blood pressure has been unstable. Stress is not a neutral factor for your cardiac situation. You're asking me to protect my health by letting them walk over you. I'm asking you to let me assess what I actually need and what's theater, she said. There's a difference. He considered that for a longer moment than she expected. It was one of the things she had come to understand about him in 2 days. That he was capable of actually thinking when something was worth thinking about, and that the bluster was a layer over that, not the whole thing. Fine, he said, but I'm on the call. Fine, she said. She stood and was nearly to the door when she stopped herself. Turned back. Because the card in her jacket pocket, which she'd transferred to this morning's jacket before she left the apartment, was present in a way she couldn't keep ignoring. She looked at him. Raymond, she said, Do you remember a deployment called Operation Callaway? The name hit him. She was watching for it and she saw it. A small but definite impact. The way a person's face reorganized itself when a word landed somewhere old and significant. It lasted less than 2 seconds before he controlled it, and the control itself was information. "Where did you hear that name?" he said. His voice was measured, very measured. "Someone mentioned it to me recently," she said, "in connection with some records." He looked at her for a long time. "Yes," he said, "I remember it." "Were you involved?" "It was my unit," he said. "My command." She held his gaze. "Were there medical personnel attached to your unit during that operation?" Another long pause. Something was happening behind his eyes. Not the weather of emotion she'd been reading for 2 days, something older and heavier than that. "There were," he said. She nodded once. "Okay," she said. "I'll see you at 9. She went out. In the hallway, she walked to the window at the end of the corridor and stood there for 60 seconds with her hand against the glass, looking out at Dunmore City in the early morning light. He knew. That wasn't the question. The question was what he knew, and what he'd done with it, and whether those were the same thing or something more complicated. And the complication mattered because in 2 days she had come to understand Raymond Voss as a person, which was a problem she hadn't anticipated and wasn't sure what to do with. She went back to her shift. The 9 o'clock meeting was in a conference room on the administrative floor, a room that had been designed to communicate authority, which meant a long table, chairs with arms, and a view of the parking structure that was somehow less inspiring than it was probably supposed to be. Dr. Harlan Price was already seated when Claire and Deborah arrived. He was in his mid-50s, silver-haired, the kind of man who had learned to use stillness as a management tool. Beside him was a woman Claire didn't recognize. Administrative counsel, from the badge. Patient advocacy had sent a representative, a young man named Dennis Farrow, who had clearly not expected to be in a room with the chief of clinical operations today and was doing his best not to show it. A tablet on the table was propped against a water glass. The call connected at 9:02. "Colonel Voss," Price said, the way you said a name when you were acknowledging someone you hadn't expected to have to deal with. "Thank you for joining." "I'll be brief," Voss said through the tablet speaker. His voice was clear and level. "I understand the concern raised about the consent process on Sunday. I'm prepared to address it directly. What specifically do you believe I failed to understand?" Price glanced at the counsel beside him. "The concern isn't about your comprehension, Colonel. It's about the process by which the information was communicated and whether the process," Voss said, "was direct and accurate. I was told what was happening in my body, what the surgical intervention involved, what the risks of declining were, and I made a decision. Is there a specific element of that exchange you'd like to review?" Farrow, from patient advocacy, was writing something in his folder. "Colonel," Price said, "the concern was raised by a member of the surgical team who was not present during the conversation in question, who based her concern on second-hand characterization." A pause. "I've reviewed the formal complaint. Whoever drafted the language about coercive communication did so without speaking to me." The patient. Another pause, shorter. "I'd like an explanation for that." Price shifted in his chair. "Standard procedure doesn't require—" "Standard procedure," Voss said, "is whatever you say it is. That's the problem with standard procedure in institutions. It's flexible in the direction of whoever has authority." He stopped. When he spoke again, his voice was slightly quieter and significantly more deliberate. "I'm going to say this once. Claire Merritt told me the truth about my medical situation when other people in this building were either avoiding it or softening it to the point of uselessness. That truth allowed me to make an informed decision that resulted in me still having my leg. If your institution's response to that is to punish the person who is honest with me, then you have a problem that is significantly larger than one nurse's case management approach." Silence in the conference room. Price looked at the tablet for a long moment, then at Claire. She met his gaze and said nothing. She had decided last night that the less she said in this room, the better. Not because she had nothing to say, but because Voss had said it and Farrow was writing it down, and the counsel beside Price was very carefully not making eye contact with her client, which was its own kind of information. "I'll need to review the patient advocacy documentation," Price said finally. To Deborah, not to Claire. The reassignment is on hold pending that review. How long? Deborah asked. End of week. He clicked his pen closed. We're done here. The call disconnected. Farrow gathered his folder. The counsel for administration was already on her phone with her back to the room. In the elevator going down, Deborah looked at Claire. End of week, Deborah said. He's buying time. I know.
Farrow looked shaky. He'll hold. She had read Farrow in the first 2 minutes, but young, earnest, the specific earnestness of someone who had taken the patient advocacy role because they actually believed in it, which was rarer than it should have been. He would hold. Price is going to look for another angle. What do you mean? He pushed on the consent process and it didn't stick, so he'll look for something else. She stepped out of the elevator. He's not done. She was right. She found out what angle at 11:40 when Deborah appeared at the nursing station with the expression that meant something new had gone wrong. HR, Deborah said. They've been asked to pull your employment file for review. Claire set down the chart she was holding. On what grounds? The request cites background verification discrepancies. Deborah said it carefully, like she was handling something she wasn't sure of the weight of. They're saying there are gaps in your documented work history prior to Hargrove General. There are no gaps. I was traveling between positions. That's in the file. I know. I pulled it this morning when I got the notification. Deborah lowered her voice. Claire, the gaps they're flagging, they're not in the work history. They're in the period before your nursing career, a 4-year window. A pause. They're saying the file doesn't account for that time. 4 years, she knew exactly which 4 years. This is Price, she said. Almost certainly. Deborah's jaw was tight. He's changed the angle. Consent process didn't hold. Now he's questioning your credentials. My nursing credentials are fully documented. Every certification, every renewal. I know that, you know that. But if he can keep HR occupied reviewing your background long enough to make the situation look complicated, Deborah stopped. It creates noise, and noise is enough to justify the reassignment while everything gets sorted out. Claire picked the chart back up. Put it down again. How long does HR have to respond? Technically 72 hours for an urgent request, but Price flagged it as non-urgent, so they have a week. A pause. Same timeline as the patient advocacy review. Same timeline. Not a coincidence. He's trying to run out the clock until Voss is discharged, Claire said. Once Voss leaves, the patient advocacy complaint loses its primary witness, and the whole thing gets quieter. Deborah didn't say yes. She didn't need to. Then we move faster, Claire said. How? She thought about the card in her jacket pocket, about Thomas Garrett and what he'd told her in the bar on Pendleton Avenue and the investigation that had been running for 18 months and was, according to Garrett, getting close to something formal, and about the name at the center of it lying in a step-down room on the 3rd floor with better color than yesterday and a fever that was finally dropping. I need to make a phone call, she said, on my lunch break. She made the call from her car in the parking structure at 12:15. The number on the card rang twice before a man answered, a voice that was clipped and direct in the way of someone who took calls like this all day and had stopped performing patients around them. Special Agent Doran, my name is Claire Merritt. I was told to call this number. A short pause. Yes, I've been expecting you might call. Another pause. Thomas Garrett. Yes. Ms. Merritt, can I confirm you're willing to speak to me voluntarily? You're not required to. I know I'm not required to, she said. I'm calling because there's a timeline issue, and I think you need to know about it. All right. She heard the sound of something. A chair, a door closing. Go ahead. She told him about Price, about the reassignment attempt and the patient advocacy filing and the HR background review request. She laid it out in sequence, factually, without editorializing, the way she'd been trained to report situations where the details mattered. She did not tell him she'd been thinking about this since 4 a.m. She did not tell him that the fact she was calling a federal investigator felt like stepping back into a current she'd spent 2 years wading out of. When she finished, Doran was quiet for a moment. You're telling me this because of the timeline, he said. The primary witness for my patient advocacy complaint is a patient who may be discharged by end of next week.
If administration can run out the clock, I understand. A pause. I want to be clear about something. The investigation I'm working is separate from your situation at the hospital. Those are two distinct tracks. I understand that. But there may be overlap, he said, in terms of the subject. She said nothing. Raymond Voss, Doran said. Garrett told me his name came up in your investigation. It came up significantly, Doran said. We have documentation indicating that personnel records from Operation Callaway were altered during a period when Colonel Voss had administrative access to the relevant archive system. We have a chain of custody issue, and we have witness statements that contradict the altered records. A pause. We don't yet have a direct link between Voss and the specific alterations. That's what we're still building. What's in the altered records? She said. Silence. Agent Doran, she said, whatever is in those records, it's my record, my service. Whatever was changed, it was changed about me. I have a right to know what it says now versus what it should say. A longer silence. The records for the medical personnel attached to Voss's unit during Callaway, Doran said carefully, show an incident in the field. A situation where a combat medic acted outside of authorized parameters, administered treatment to civilian casualties in an engagement zone in a way that the record characterizes as having compromised unit operational security. A pause. The characterization in the current record is not favorable. She stared at the concrete pillar in front of her car. And the witnesses say something different, she said. Significantly different, Doran said. The witnesses describe a situation where the medical personnel in question performed under hostile fire, treated both military and civilian casualties simultaneously, and in doing so prevented a situation from escalating that would have resulted in substantially higher casualties on all sides. He paused. The record as it stands doesn't say that. The record says the opposite, that the incident endangered the unit. She closed her eyes, opened them. How many witnesses? She said. 4, he said. All former members of Voss's unit. 4 people had remembered what happened. 4 people, over 12 years, had remembered it correctly and eventually told someone. She thought about what that meant, and then stopped thinking about it because the parking structure was not the place to do that. What do you need from me? She said. A formal statement, ideally in person, at our field office. And I want to be honest with you. I'd like it within the next 48 to 72 hours, because we are, as Tom probably told you, getting close to a formal filing, and having your statement before that happens is important for how this goes. Where's your field office? Dunmore City. We've had a team here for 3 weeks. A beat. We came here because of Voss. Because of Voss, who had been admitted to Hargrove General 4 days ago with a leg infection that had been building for a week. 3 weeks before that, a federal investigation team had set up in the same city. She thought about coincidences and dismissed them. I'll come in tomorrow morning, she said, before my shift. 7 a.m. works. 7, she said. She ended the call and sat in the car for a moment. The parking structure hummed with the ambient noise of the building's ventilation system. Somewhere below, a car alarm went off briefly and then stopped. She went back to work. The afternoon was Voss's best since admission. His fever broke cleanly at 217. She was checking his temperature when it happened, the reading coming back at 99.1, and then, an hour later, at 98.6, and she made the notation in his chart with the specific satisfaction of watching a tide turn. Morrow came by at 3 and reviewed the left leg, which was responding to the revised antibiotic protocol in the way textbooks described and bodies only sometimes cooperated with. The inflammation margins were receding. The skin tone was normalizing. Another 48 hours at this rate, Morrow said, in the hallway outside the room, and I'll feel comfortable talking about a discharge timeline. She looked at Claire sideways. You look like you haven't slept. I'm fine. I'll pretend I believe you. Morrow pulled up the chart on her tablet. He's been asking about you every time anyone goes in there. The night crew noted it. The surgical fellow noted it. She paused. Whatever you did in the first 24 hours, it stuck. I told him the truth. Apparently that's rare enough to stick. She clicked off the tablet. You're good with him. I've dealt with that type before. Combat veterans who've been in command, they don't give it up easily. Usually you can either manage them from a distance or you fight them constantly. You found a third option. He found it, Claire said. I just didn't get out of the way. Morrow looked at her for a moment with the particular expression of a physician who had learned, over years of residency and practice, that nurses often understood things about patients that physicians missed entirely. "Whatever's going on with administration, for what it's worth, you have my support. I'll put that in writing if it helps." "It might," Claire said. "Thank you." She went back in. Voss was eating his dinner tray with something approaching appetite, which was new and significant. He looked up when she came in, and she could see him reading her the same way he always did, quickly, from the door, the full-length assessment, before she'd said a word. "Better than this morning," he said. "What happened?" "Morrow is happy with how the left leg is progressing. Fever's been down for 2 hours. You're trending in the right direction." She checked his dressings. "How's the pain?" 3, said without his usual resistance to the scale. "Good." She sat in the chair. For a moment, neither of them said anything, and the silence was the comfortable kind. The kind that happened between people who had established enough of a vocabulary that quiet didn't need filling. "The meeting went all right this morning," he said. "It went all right," she agreed. "He's not done, though. Price." "I know." He put the fork down. "He requested your HR file." "How do you know that?" "Patient advocacy called me as a follow-up. Told me about the background review request as part of the documentation for my complaint." He looked at her steadily. "They flagged it as potentially retaliatory." "It probably is. What are you going to do about it?" She looked at him. She had been thinking, since the parking structure, about how much to say and when and to whom, and she had not arrived at a clean answer. The investigation was a separate track. Doran had said so. Her situation at the hospital was a separate track, except that they shared a name, and that name was sitting across from her eating a dinner tray with improving appetite, and she was running out of ways to keep the tracks from converging in her own head. "I'm working on it," she said. He looked at her the way he had looked at her 2 days ago when she deflected the MOS question. The same recognition, the same decision not to push, the same quality of waiting. "The Calloway question this morning," he said. She went still. "I've been thinking about it since you asked," he said. His voice had dropped in register. "About why you'd ask? About who told you that name?" He looked at the dinner tray without seeing it. "The answer to your question, whether there were medical personnel attached to my unit. There was one." He paused. "A combat medic. Attached to us for the duration of the operation." Another pause. "Female. Best field medic I've ever seen work." She said nothing. "I've thought about her a lot over the years," he said. "What happened to her after? Whether she stayed in." He looked up. "Whether she was all right." The room was very quiet. "Raymond," she said. "I know," he said. He said it like someone who had already arrived at a destination and was waiting for the other person to catch up. "I've known since yesterday morning, the way you handled the IV line, the way you moved through a crisis, the triage logic." He paused. "I put it together. And then I thought I was wrong because I wanted to be wrong, because the alternative is—" He stopped. "The alternative is what?" she said. He looked at her directly. "The alternative is that you've been taking care of me for 4 days without telling me who you are." A pause. "And that I owe you something that is significantly larger than a consent form statement." She held his gaze. "Tell me," he said. "Am I wrong?" The question sat between them. The monitor beeped. The dinner tray was cooling. Outside the window, Dunmore City was starting its evening. She had made a decision in the parking structure. She had also made a decision in the bar on Pendleton Avenue, and another one at her kitchen window at 4:30 this morning, and another one on the corner of 4th and Pendleton when the traffic light cycled through. She was used to making decisions sequentially, under conditions that didn't allow for second-guessing them, and this was another one of those. "No," she said. "You're not wrong." Raymond Voss closed his eyes. For a moment she watched him. The large frame, the gray hair, the hands that were resting open on the bed in a way that was different from how he'd held them all week. Not clenched, not armored, just open. When he opened his eyes, they were different than they had been. "Why didn't you say something?" he said. "Because my job was to keep you alive," she said. "Everything else could wait." He absorbed that, nodded slowly. "And now," she took a breath, "now I need to ask you something, and I need you to tell me the truth." Whatever the truth is. He looked at her. Ask. After Callaway, she said, what happened to the operational records from that deployment, the medical records, the incident reports? She kept her voice level and direct. Do you know if they were accurate? The room changed. She had spent 4 days reading Raymond Voss's face, and she read it now the way she read everything in a crisis, sort of fast, looking for the signal under the response. What she saw was not what she expected. It wasn't guilt. It wasn't defensiveness. It wasn't the quick reorganization of a person caught. It was grief. Old settled grief, the kind that had been living in a person for years and had become structural, load-bearing, part of the way they held themselves up. No, he said. One word. Complete. What happened to them? She said. Someone changed them, he said, after the fact, about 8 years after Callaway. His voice was quiet and very controlled. I found out 2 years ago. I've been trying... He stopped, started again. I have been trying to correct the record for 2 years, and I have not been able to do it without a formal investigation process because the person who made the changes had enough access and enough cover that my word alone wasn't sufficient. She stared at him. I know what the current record says about the Callaway medic, he said. I know it's wrong. I've known it was wrong since I saw it. He looked at her with the grief still there, open now, not hidden. I have been trying to fix it. The silence lasted long enough that she could hear the ventilation system. Who changed it? She said. He said a name. Not Garrett's. Not Doran's. A name she didn't know. A name she filed immediately, precisely, the way she filed everything that mattered. He was in my unit, Voss said. Admin officer. After the deployment, he went into logistics, then procurement. He had archive access through a DoD contractor role. His jaw tightened. He changed those records to protect himself. There was an incident during Callaway that he was responsible for, a decision that he shouldn't have made. The way the records read now, the blame falls on the medic. He stopped. On me, she said. He looked at her. Yes, he said. On you. She stood up, not from anger, from the need to do something with her body while her mind processed. She walked to the window and stood there with her back to him for a moment, looking at the parking structure and the gray early evening sky. There's a federal investigation, she said, without turning. JAG and CID. They've been building a case for 18 months. They have witness statements. They have a chain of custody problem with the archive access. She paused. They have his name. She heard him shift in the bed. They called me, he said behind her. 3 weeks ago. Doran. She turned. You're cooperating. I've been cooperating since they called. His voice was flat and real. I told them everything I knew. I gave them documentation I'd been keeping for 2 years. I told them I had physical records from the deployment, my personal copies. I kept copies of everything. It was habit. 28 years. He looked at her. I came to Dunmore City because the field office called me in for an in-person interview. I was going to go in on Monday. A pause. I ended up in the ER on Sunday night instead. She stared at him. The leg, she said. The leg, he said. I'd been ignoring it for a week because I had something that felt more important to deal with. He held her gaze. I was trying to fix what he did to your record. That's why I was here. That's what I've been doing. The monitor beeped 3 times and then settled. She stood at the window of room 318 in Hargrove General Hospital in Dunmore City and looked at the man who had thrown a tray on the morning she'd walked in and told 2 other nurses to get out, and she tried to hold the full shape of the thing she was looking at. Not just the surface, not just the last 4 days, but all of it. 12 years compressed into a single room. Her phone buzzed. She took it out of her pocket. A number she didn't recognize. Not Garrett, not Doran. A text that was 4 words long. He's been compromised. Tonight. She read it twice. What is it? Voss said. She looked up. Raymond, she said. Who else knows you're here? In this hospital, in this city. He looked at the message she was holding up toward him. The investigator, he said slowly. Doran, Garrett, and... He stopped. His face went through something fast and controlled. And my former admin officer, who I called 2 weeks ago to tell him I was cooperating. The room was very still. Why? She said. Because I wanted him to know it was over, Voss said. I wanted to give him the chance to come forward on his own. Did he respond? He said he'd handle it. She put the phone in her pocket. Raymond, she said, and her voice had changed. Not in volume, but in register. The specific shift that happened when things moved from the category of complicated to the category of urgent. I need you to tell me right now whether there is anything in this room, documents, records, anything, that you brought with you from whatever you were doing before you came to the ER. He looked at her, and then, slowly, my personal files. From the deployment. I had them in my bag when I came in. Where's the bag? Intake took it. It should be in patient belongings storage, she said. Ground floor. She was already at the door. Merritt! His voice stopped her. She turned. He was sitting upright, all the post-surgical fatigue burned off by something else, and his eyes had the quality she imagined they'd had in the field. Clear, fast, no distance between thought and decision. Whatever's about to happen, I need you to know what you did in that deployment. What you actually did. I put it in writing 12 years ago, and I kept the copy. He held her gaze. The record is wrong. What you did was right, and I've never... He stopped. I know, she said. I should have protected that record, he said. You're protecting it now, she said. I'll be back. She went out into the hallway, and the hallway looked exactly the same as it always did. The nursing station, the medication cart, the soft institutional light of a hospital floor past dinner hours. She walked fast and then faster, and when she hit the stairwell, she ran. The stairwell was empty. She took the stairs 2 at a time, not running the way civilians ran, arms pumping, off balance, noisy, but the controlled fast descent of someone who had moved through bad situations in worse conditions and knew that speed was only useful if you arrived functional. 3 flights. Ground floor. She pushed through the fire door into the main corridor and turned left toward admissions without breaking stride. Patient belongings storage was behind the intake desk, a locked room, wire mesh shelving, personal items tagged and bagged and cataloged at admit. Standard procedure. She knew it because she'd signed things in and out of it 100 times in her time at Hargrove General, returning wallets and phones and watches to patients who were well enough to want them back. The intake clerk was a woman in her 30s named Paula, who had worked the desk for 4 years and who recognized Claire from the floor. She looked up when Claire came around the counter without stopping. Hey, you can't come back. I need to pull belongings for room 318, Raymond Voss, admitted Sunday night. You need to fill out a... Paula. Claire stopped at the storage room door, looked at her directly. Is there anyone who's been back here in the last 2 hours who shouldn't have been? Paula blinked. What? Has anyone requested access to patient belongings tonight? Specifically 318? Paula's expression shifted from irritation to something more uncertain. There was a guy, maybe 40 minutes ago, said he was a family member. What did he look like? 50s, gray suit. Said his name was... Paula checked the log. Harwick. Said he was the colonel's brother-in-law. Wanted to pick up some documents the colonel needed. Did you give him access? I told him I needed the patient to authorize it in writing. He said he'd go up and get it. Paula looked at the log again. He hasn't come back, which meant he was upstairs. Call security, Claire said. Right now. Tell them you have an unauthorized individual on the 3rd floor attempting to access a patient's room without authorization. Do it now. She was already moving back toward the stairwell. Paula picked up the phone. Yeah. She took the stairs at the same speed and came out on the 3rd floor into the hallway and saw him immediately. He was outside 318, not inside it, standing at the door with his hand on the frame in the particular way of someone who had just knocked and was waiting or pretending to wait, which was different. 50s, gray suit, the build of someone who had been military once and had spent a decade in an office since. He turned when he heard the fire door open. Their eyes met. He knew she wasn't staff the moment she looked at him that way. Not the way a nurse looked at a visitor, not the managed distance look of institutional caution, the look of someone who had already assessed the situation and had already decided. He took 2 steps toward the elevator. She moved to put herself between him and it. Mr. Harwick, she said. He stopped. Something shifted in his face. The particular reorganization of a person recalculating. I'm here to see Colonel Voss, he said. His voice was practiced. Reasonable. The voice of someone who had navigated institutional situations before and knew how to sound like he belonged in them. The patient hasn't authorized your visit, she said. And you told the intake desk you were a family member. Colonel Voss's intake form lists no family members. She kept her voice level and her position between him and the elevator. So I'm going to ask you to stay right here until security arrives. His jaw tightened. You don't have the authority to. I'm a nurse on this floor. You're an unauthorized visitor outside a patient's room. I have exactly enough authority. She didn't raise her voice. Stay where you are. He stayed. But she could see him thinking, the quick lateral calculation of someone running options. The stairwell was behind him. She was in front of him. The nursing station was 20 feet to her right where Davis, the incoming nurse, was at the terminal and had looked up when the tone of the hallway changed. Davis, she said, without taking her eyes off the man in the gray suit. Can you come stand here, please? Davis, 27, newer than she would have wanted, but present and paying attention, came around the station and positioned himself to her right without being told exactly where. Good instinct. The elevator dinged. 2 security officers came out. Harwick looked at them, and then at Claire, and the calculation on his face completed itself in a way that wasn't resolution. It was the particular expression of someone who had already moved to the next position in his head, which was the position of a person who knew when a situation had stopped going their way and had started building the argument for why it wasn't his fault. This is a misunderstanding, he said to the security officers. I'm a colleague of the patient. We'll sort that out downstairs, the first officer said. They took him to the elevator. He went without physical resistance, which told her things about him. Not brave in the tactical sense, not someone who'd take a physical confrontation when an institutional one was available. He went smoothly and cooperatively, and he was already thinking about his next move before the elevator doors closed. She watched the doors close. Then she went into 318. Voss was not in the bed. For one alarming second, she registered the empty bed, the pulled-back blanket, the IV line hanging loose from the stand, and then she saw him. He was standing at the window. Standing, not sitting, which was more than he should have been doing 4 days post-surgery, and he was holding his phone. Raymond! She crossed the room fast, took his arm, not pulling, stabilizing. You need to be in bed. I know. He didn't move immediately. Was it him? Gray suit, 50s, called himself Harwick. Something moved across his face, recognition, then a cold contained anger. Harwick is his alias, his working name for the contractor role. He let her guide him back to the bed, lowering himself carefully, the post-surgical effort visible in his jaw even though he wasn't going to say so. His real name is Dennis Farrow, former admin officer, my unit, Callaway deployment. He let her reattach the IV line. He's been operating under a contractor identity for 6 years. That's part of what made it hard to trace the archive access back to him. He told intake he was your brother-in-law. I don't have a brother-in-law. He settled against the pillows. His color was off. Exertion and adrenaline, not infection. She checked his pressure without asking. It was elevated but not in dangerous territory. He came for the documents. He didn't get to them. Your bag is still in storage. She made the notation in his chart and then looked at him directly. He knows you're here. He knows you're cooperating with the investigation, and he just showed up in person, which means he's moved from hoping to contain the situation to actively trying to interfere with it. That's a mistake on his part, Voss said. Why? Because Doran has been watching him. His voice was steady. When I spoke to the investigation team 3 weeks ago, they told me they had eyes on Farrow. They were waiting for him to move. They needed documented evidence of an attempt to tamper with records or witnesses before they had enough for a formal filing. Usapat okait malcharsa. He looked at her. He just walked into a hospital and tried to retrieve documents from an actively cooperating witness. He did it under a false identity. And I'm going to guess that your security desk has him on camera. Ads. She thought about Paula at the intake desk, the visitor log, the camera above the storage room door that she'd signed forms under 100 times without thinking about it. She picked up her phone and called Doran. He answered on the second ring. Dennis Farrow just tried to access patient documents at Hargrove General, she said. He's in security custody downstairs. He came under a false name. There's camera footage. A pause that lasted exactly long enough to mean something. When? 30 minutes ago. He's still in the building. Don't let them release him. Doran's voice had changed. The clipped professional tone had sharpened into something with urgency underneath it. I need 20 minutes. I'll call downstairs. She called security, identified herself, explained the situation in enough words to be clear and few enough to be fast. The officer on the other end hesitated. He was a hospital security guard, not law enforcement, and the gap between those things was suddenly very relevant. She told him that a federal investigator was 20 minutes out and that releasing the individual before then would create a problem that was significantly above everyone's pay grade. He put her on hold. She waited. He came back and said they'd keep him in the security office. She hung up and looked at Voss. 20 minutes, she said. He nodded. She sat in the chair. Doran arrived in 18. He was younger than his voice. Mid-30s, the build and haircut of someone former military who'd moved into federal investigation and kept the physical habits, in a dark jacket that wasn't quite a suit. He had a second agent with him, a woman who introduced herself as Reyes and said nothing else. They went to the security office first and were in there for 11 minutes, and then Doran came up to the third floor while Reyes stayed with Farrow. He knocked on the door of 318 and introduced himself to Voss, which was a courtesy. They had spoken before, but that had been on the phone. In person, it was different. Claire watched them take each other's measure in the first 15 seconds, the way people did when they were both used to reading rooms. Mr. Farrow is being detained, Doran said, for formal federal detention, not hospital security. He'll be transported within the hour. He pulled out a small recorder. Colonel Voss, I need to ask, was the individual you saw in the hallway consistent with your identification of Dennis Farrow? Yes, Voss said. He never entered the room? He was at the door when security arrived, Claire said. He didn't come in. Doran looked at her. Your observation of him, what was your read? He was calm. Too calm for someone who'd just been caught. He was already building a narrative. She kept it precise and factual. He's done this before. Not this specific situation, but the version of it where you talk your way out of something institutional. He knows the language. Doran made a note. That's consistent with what we know about him. He clicked off the recorder. I want to be direct with both of you about where this stands. Farrow's presence here tonight is what we needed. We have him under a false identity in a hospital, attempting to access documents belonging to a witness who had informed him of federal cooperation. That's tampering. That's obstruction. He paused. Combined with the archived chain of custody evidence and the witness statements we've already collected, we have enough to file. How long? Voss said. Filing within 48 hours. Formal charges probably 72. Doran looked at him steadily. And Colonel, the record corrections will be part of the formal resolution process. That's already documented in our case materials. When the original records are restored, it goes through official channels, it goes into the permanent file, and it becomes definitive. Voss looked at Claire. She was looking at the window. There's one more thing, Doran said. He turned to Claire. You're coming in tomorrow morning. 7 a.m., she said. Make it 8. I'll need more time now with the situation tonight. He stood. I'm going to need both of you to be available by phone for the next 48 hours. Don't discuss the specifics of this conversation with anyone outside this room except Garrett. He picked up his jacket. Thank you for the call. That was the right move. He left. The room was quiet. Voss let out a slow breath, the kind that a person held through an acute situation and released only when it was genuinely over. You should sleep, Claire said. I won't. I know, but you should. She checked his pressure again, still elevated, still not dangerous. Your body has been through enough today without adding whatever tonight just cost you. He looked at the ceiling. She was 26, he said. She went still. The medic, Calloway. He kept his eyes on the ceiling. 26 years old, and she moved through that engagement zone like she'd been doing it her whole life. I've had soldiers twice her age freeze when the shooting started. She never froze. A pause. I wrote a commendation. At the time, 3 paragraphs. I filed it through standard channels. He stopped. When I found out what Pharaoh had done to the record, I went back to find the commendation. It was gone. Everything that should have been there, gone, replaced with the incident report he fabricated. She sat very still in the chair. I should have checked earlier, he said. I should have followed up. After the deployment, He stopped. I was dealing with other things. I trusted the process. That was a failure of judgment on my part. You didn't know, she said. That's not an excuse. No, she agreed. It's not. A pause. But it's also 12 years ago, and you've spent the last 2 trying to fix it. So. He turned his head to look at her. So, he said. The word sat there for a moment. Why nursing, he said. After. She thought about how to answer that, whether to answer that. It was past 10 at night, and there was a federal agent 2 floors below them, and she had to be at a field office at 8 in the morning, and she was running on no sleep and something that wasn't quite adrenaline but was in the same family. She thought about all of that and then set it aside. Because it was the closest thing, she said, to what I was already doing, without the other parts. He nodded slowly. He understood what the other parts meant. Are you glad, he said, that you left? Some days, she said, not every day. That's honest. You asked for honest. He looked back at the ceiling. You were good at it, he said. The field medicine. You were exceptional. I want you to know I knew that at the time. I said it at the time, in writing, to the people who were supposed to record it. A pause. I'm sorry that the record doesn't reflect it. She looked at her hands for a moment. It will, she said. She left at 10:40. Voss was not asleep when she went, but his eyes were closing in the particular involuntary way of a body that had hit its limit and was going regardless of what the mind wanted. She turned off the overhead light and left the monitor running and went out quietly. In the hallway, Davis was at the station. He looked at her with the expression of someone who had watched a significant amount of activity on a floor he'd barely gotten oriented to and was still processing it. Is everything? He started. He's stable, she said. Pressure's elevated from the stress of tonight. Watch it overnight. If it goes above 160 systolic, call the attending. She picked up her jacket from the break room. The security situation is handled. There'll be no further unauthorized visitors. Hospital security has his photo from the camera footage, and the federal team will be in contact with the admin office tomorrow. Federal team, Davis said. I'll explain what I can tomorrow, she said. Tonight, just watch his pressure. She went home. But she slept for 4 hours, which was more than she'd expected and less than she needed, and was at the federal field office on Granger Street at 7:58. The building was the kind of anonymous that was itself conspicuous. A converted commercial space in a block of offices, nothing on the exterior to indicate what it was. She'd have known it was government by the quality of the locks and the camera angles. Doran met her at the front desk and took her back to a conference room that had a table, 4 chairs, and a recorder on a tripod in the corner. Reyes was already there. And Garrett. She looked at Garrett when she came in. He looked back. The 22 months between them were present in the room, but neither of them addressed it. Sit, Doran said. She sat. I want to record your statement, he said. Full account of your time in service, specifically the Callaway operation, the incident described in the current record versus your recollection of what actually occurred, and anything else you believe is relevant. He looked at her. This statement, along with Colonel Voss's prior statement and the 4 witness statements we already have, will form the evidentiary basis of the official records correction request. It goes to JAG and to the relevant service branch archive. He paused. Are you willing to do this? Yes, she said. Take as long as you need. She took 2 hours. She had not spoken about Callaway in detail since the debriefs that happened at the end of the deployment, 12 years ago. And those had been tactical debriefs. What happened? Who was where? What resources were used? Not this kind of accounting. This was different. This was the full version, in sequence, with the context that tactical debriefs didn't have room for. She talked about the unit, the deployment conditions, the specific engagement where the fabricated incident report claimed she had compromised operational security. She laid out the timeline, who gave which order, where she was positioned, what she was treating, and why. What the alternative would have been if she hadn't acted. She talked about the casualties, military and civilian, and the specific triage decisions she made under fire, and why she made them, and what would have happened if she hadn't. Doran and Reyes asked questions. Clear, technical questions. She answered them in the same register. Clear and technical and specific. Garrett didn't speak. He sat at the end of the table with his hands folded and listened. And once, when she described a particular moment in the engagement that she'd been carrying for 12 years in the specific way you carried things that had cost something, he looked at the table. She finished. Doran clicked off the recorder. "Thank you," he said. That fills significant gaps in what we have." "What happens now?" she said. "Farrow was processed last night. He's been charged with obstruction of a federal investigation, tampering with federal records, and impersonating a family member for the purpose of accessing protected patient property. That last one is a state charge, which we're coordinating with the DA's office." Doran leaned forward. "He made a statement last night. He tried to frame it as protecting himself from what he described as a false investigation. He named Voss as the source of falsified claims against him. He's saying Voss fabricated this. He's saying Voss has a personal grudge and manufactured the record concern." Doran's expression was flat. That argument was significantly weakened by the fact that he used a false identity to attempt to access a hospital patient's personal documents, which tends to undermine the innocent man narrative. A pause. "His attorney arrived this morning. He'll try to negotiate. That process takes time, but the court case doesn't depend on his cooperation. We have the chain of custody. We have the witnesses. We have what happened last night, and now we have your statement." He closed his folder. "The formal filing is tomorrow." She nodded. "One more thing," Doran said. He glanced at Garrett, then back to her. "As part of the records correction process, JAG will be issuing a formal notation. The fabricated incident report will be removed and replaced with the accurate account. The commendation Colonel Voss submitted 12 years ago, the one Farrow suppressed, it still exists in the original draft form in Voss's personal copies, which he has turned over to us." He paused. "It will be officially processed, formally entered into your record." She looked at the table. "I know that's 12 years late," Doran said. "Yes," she said. "It is." She said it without anger, just as fact. 12 years was 12 years, and the record being corrected now was better than it not being corrected, and neither of those things canceled the other out. She was back at Hargrove General by 11:15. She changed, clipped her badge, and went to the nursing station. Davis gave her a handoff that was thorough enough that she revised her opinion of him upward. Voss had slept. His pressure had come down overnight. Morrow had done an early morning review of the left leg and had used the phrase "very encouraging" in her chart note, which from Morrow was approximately equivalent to a standing ovation. She went to 3118. He was eating breakfast. Real appetite. Not the forced compliance of the first 2 days or the tentative progress of the third and fourth, but actual hunger, the plate going down faster than she'd seen. He looked up when she came in. "You were out early," he said. "Had an appointment." She checked his overnight chart on the terminal. "Pressure's better." "I know." Davis checked it 4 times. He said it without complaint. She told Davis to watch the pressure, and he had, which was exactly what she'd asked. "How did it go?" "I gave my statement." She set the tablet down. "Farrow was charged last night. They file formally tomorrow." Something moved through him. Not relief exactly. Something more like a long-held thing being set down. "Good," he said. "Your commendation," she said. "The one you filed. They have your original draft. It's going to be formally processed." He looked at his breakfast tray. "That should have happened years ago." "Yes," she said. "It should have." She sat in the chair. Outside the window, Dunmore City was doing its mid-morning thing. A clear day, the sky the particular blue of early summer, the kind of day that had nothing to do with what was happening in the building below it. "Raymond," she said. I want to say something, and I want you to just hear it without responding until I'm done." He set the fork down, gave her his full attention. What happened to the record? That was Pharaoh. What happened to the commendation? That was Pharaoh. I know that. She kept her voice even. And I know you've spent 2 years trying to correct it, and that the reason you were in Dunmore City was to assist the investigation, not to avoid it. She paused. I know all of that. He waited. It still took 12 years, she said, and 12 years is 12 years. And some of the things I've carried in those years, some of the ways things were harder than they should have been, because the record said what it said, I can't uncarry those. They happened. She looked at him steadily. I'm not telling you that to hurt you. I'm telling you because I'm not the kind of person who pretends things didn't happen the way they happened. I know you're not, he said. And also, she said, you're alive, and the record is going to be corrected, and Pharaoh is sitting in a federal holding facility. She paused. So, he looked at her for a long moment. So, he said, so that's where we are. That's where we are, he agreed. A pause. Is that enough? He said. Not defensively. A real question. She thought about it honestly. I don't know yet, she said. Ask me in a year. He nodded. Once. The precise military nod that she'd come to recognize as his version of understood. The situation in hospital administration moved faster than she expected. At 1:15, Deborah appeared at the nursing station with an expression she couldn't quite categorize. It wasn't relief. It was the face of someone watching a Rube Goldberg machine complete its sequence in a way they hadn't entirely anticipated. Price called me, Deborah said. When? 20 minutes ago. She leaned against the station, keeping her voice down. He's dropping the reassignment request. The patient advocacy filing combined with, he said there were some administrative concerns that had come to his attention about the HR background review request. He used those exact words. Administrative concerns. What kind of concerns? He didn't specify, but the HR review has been suspended. Deborah looked at her. Do you know what happened? Claire thought about Doran, about the federal filing tomorrow, about the fact that Hargrove General's chief of clinical operations had, in the space of 3 days, attempted to remove a nurse from a case where the patient was an active witness in a federal investigation, and had requested a background check on that same nurse under circumstances that a patient advocacy office had already flagged as potentially retaliatory. I have some idea, she said. Deborah looked at her for a long moment. Should I ask? Probably not today, Claire said. Tomorrow, maybe. Deborah straightened up. Your assignment stands. You're on 318 through discharge. A pause. And Claire, whatever you did or didn't do in the last 48 hours, Price backed down. In 11 years at this hospital, I have never seen Harlan Price back down. Everything backs down eventually, Claire said, if you find the right lever. She went back to her rounds.
Set.
At 3 in the afternoon, Morrow came up to the floor with the imaging from the morning review on her tablet and spent 12 minutes in Voss's room. Claire was in the doorway for part of it. The left leg is responding well, Morrow told him. The right is healing as expected for the extent of the debridement. You're going to need outpatient wound care, and I want to see you for follow-up in 2 weeks, then again at 6 weeks before we reassess the PT timeline. She scrolled through the images. Barring any change in the next 24 hours, I'd like to target discharge for Saturday morning. 2 days, he said. 2 days, she confirmed. Which means I need you to cooperate fully with the physical therapy team tomorrow. The goal isn't mobility by Saturday. It's demonstrating you can manage transfers safely and that you have a discharge plan that isn't just going home and sitting in a chair. I can do that. Good. Morrow clicked off the tablet. I'll update your attending. She was at the door when she paused. Colonel, you had a serious infection that most people wait too long on. You're recovering faster than the textbook says you should. She didn't exactly look at Claire when she said the next part, but the angle of her gaze suggested it. Good care makes a difference. She left. Voss looked at Claire. She knows, he said. She's observant, Claire said. Most good physicians are. Boo! The afternoon was quiet in the way that days were quiet when the acute part was over. and what remained was the careful work of return. Vital checks, medication passes, the ordinary texture of a floor doing its job. She moved through it with the particular focus of someone who had learned that the quiet after a crisis was not the same as safety, that it required its own kind of attention. At 4:30, her phone buzzed. Garrett. She went to the break room and called him back. Farrow made a deal, Garrett said, without preamble. Already? His attorney moved fast. He's offering full cooperation. The full scope of the archive alterations, the chain of access, who else may have known, in exchange for a reduced charge on the obstruction. A pause. Doran took the deal. He got what he needed from Farrow's cooperation, and Farrow gets a plea that keeps him out of the worst of it. She sat down at the break room table. Is that enough? It's the way these things work, Garrett said. You don't always get the full penalty. You get the information and the formal record and the system moving in the right direction. A pause. His contractor clearance is gone. His DoD access is gone. The falsified records are being corrected through official channels starting tomorrow. That's permanent. Another pause. And the formal filing tomorrow will be public record. His name, the charges, the nature of what he did. That doesn't go away. She looked at the break room wall, the bulletin board with its rotating notices and sign-up sheets, and the hospital's mission statement in a laminated frame that someone had hung slightly crooked years ago and nobody had ever straightened. Doran also wanted me to tell you, Garrett said, that the formal records correction includes a notation, a permanent annotation in the case file indicating that the original incident report was fabricated and that the accurate account of the Callaway engagement was reconstructed from witness testimony and original documentation. He stopped. It's not nothing, Claire. I know, she said. It took too long. I know that too. For whatever it's worth, Tom, she said it quietly. Don't. He stopped. I know, she said. Okay, I know. Let's just let it be what it is. A pause. Okay, he said. She hung up. She sat in the break room for 3 minutes, not thinking exactly, processing, which was different, letting the weight of the last 4 days settle into its actual shape rather than the shape it had been taking under pressure. Then she got up, poured the coffee that someone had left sitting too long and drank it anyway because it was there, and went back to the floor. At 5:15, an incident happened that she hadn't anticipated. She was at the nursing station when Dr. Harlan Price came off the elevator. He was dressed in the same silver-haired authority she'd seen in the conference room 2 days ago, but something about his bearing had changed. The particular stiffness of a man who had been told something he hadn't wanted to hear and was now managing the fallout in public. He walked to the station and asked, without meeting her eyes fully, for a word. She gave him the courtesy of the consultation room. Inside, with the door closed, he turned and looked at her with the expression of someone who had prepared something and was deciding in real time how much of it to actually deliver. The HR review has been suspended, he said. I know, Deborah told me. The reassignment request is withdrawn. He paused. I want to be clear that the concerns that were raised in good faith. Dr. Price, she said. He stopped. I don't need the explanation, she said. I need you to hear something, and then we can both go back to our jobs. He waited. The nurse you tried to remove, she said, is the reason a patient on your floor has 2 legs right now. The background you tried to question is the reason that patient was willing to cooperate with treatment at all. And the process you tried to use against me. She stopped, chose her words with the same care she used for everything that mattered. It didn't work because it shouldn't have. And now there's a formal patient advocacy record that documents the attempt. She held his gaze. I'm not going to file further action against you. I'm going to keep doing my job. But I want you to know that the nurses on this floor are watching how this was handled, and they'll remember it. Price looked at her for a long moment. Understood, he said. He left first. She gave it a count of 30 before opening the door. What? At 6 o'clock, something happened that reordered the entire equation. She was finishing her end-of-shift notes at the station when Davis came around the corner with an expression she didn't have a name for. Not alarm, not confusion, something in between. There are people in the lobby, he said. What kind of people? Military, he said. 6 of them. In uniform. He paused. They asked for the nursing station on the third floor. They asked for you specifically. She set the tablet down, went to the elevator. The lobby of Hargrove General at 6 in the evening was in its regular after-visitor hours lull. A few people at the information desk, the gift shop closing down, the background noise of an institutional building settling into its evening shift. 6 men stood near the main entrance, dressed in service uniforms that she recognized by their branch insignia without needing to think about it. Ages ranging from maybe 40 to somewhere in their late 50s. They were standing with the particular posture of people who were somewhere official and knew how to be still in official spaces. The oldest one stepped forward when she came off the elevator. She had never seen his face before, but she knew the type. Former special operations, the specific kind of physical economy that came from years in conditions where wasted movement was a liability. He had a weathered quality and pale eyes, and he looked at her with the particular directness of someone who had decided, before coming here, exactly what they were going to say. "Are you Claire Merritt?" he said. "I am," she said. He reached into his jacket. "My name is Warren Pulaski," he said. "We were in Colonel Voss's unit, all 6 of us, different rotations." He held out a folder, not thin, several pages visible at the edges. "We have been trying to find you for a long time." She looked at the folder. "We gave statements to the federal investigation," he said, "all 6 of us. We told them what happened at Callaway, what you did." His voice was steady and deliberate. "But we also wanted you to hear it from us directly, without the paperwork, without the procedure." She looked at him, then at the other 5 men behind him, then at the folder in his extended hand, and standing in the lobby of Hargrove General at 6 o'clock on a Thursday evening, with the gift shop closing behind her and the information desk attendant trying not to stare, and 12 years of a wrong record about to be corrected through official channels. Claire Merritt felt the particular sensation of a floor she hadn't realized she'd been bracing against finally going solid under her feet. She took the folder, opened it. The first page was a letter. Handwritten, not typed. 6 signatures at the bottom, crammed together because someone had passed the page around rather than printing multiple copies. She read the first line, then the second. Then she stopped, because the third line of the letter said something that answered a question she had been carrying for 12 years. A question she had never asked out loud. Not to Voss, not to Garrett, not to Doran. A question about a specific moment in the Callaway engagement that she had never been certain of. And the third line of the letter said that she had been right. She looked up from the page at Warren Pulaski. "How long have you known?" she said. "Since it happened," he said quietly. "All of us. We've known since that day." He held her gaze. "We should have said it sooner. We know that. We're saying it now." She closed the folder, breathed. From behind her, the elevator dinged. She turned. Raymond Voss was in the elevator doorway, dressed, not in a hospital gown. Actual clothes, the civilian clothes that Davis must have retrieved from the storage room without her knowing, because someone had planned this without her knowing, and that was the thing she had missed. He was in a wheelchair because he had to be, 4 days post-surgery, not because he lacked the will. He was upright in it the way he was upright in everything, as a decision rather than a default. He looked at her across the lobby. She looked at him. She looked at the 6 men. She looked at the folder in her hand. And then a 7th man walked through the lobby's front doors, and the equation shifted entirely. She didn't recognize his face, but she recognized the insignia on his uniform immediately. The rank, the branch, the specific designation that meant he wasn't here as a witness or a colleague or a former unit member. He was here as authority. He had a briefcase and a second person with him, female, also in uniform, something in her bearing that said legal. He crossed the lobby, stopped, looked between Voss and Claire, and addressed the room with the practiced authority of someone who had done this before and understood the weight of doing it correctly. "Is this Claire Merritt?" he said. Pulaski answered before she could. "It is." The officer opened his briefcase. "I'm Brigadier General Howard Steck, Judge Advocate General's Corps," he said. "I'm here because a records correction process has been initiated through our office, and it was determined that the nature of the correction warranted a formal in-person notification rather than written correspondence." He looked at her directly. "Ms. Merritt, effective as of this morning, the incident report filed against your service record in connection with Operation Callaway has been formally removed. The original record, including the commendation filed by Colonel Voss at the time of the operation, has been restored to the permanent file. The lobby was very quiet. Additionally, Steck said, I've been authorized to inform you that the commendation, upon restoration, triggered an automatic review under the Delayed Recognition Act. That review has been completed. He reached into the briefcase. The findings of that review. He stopped. His phone rang. He looked at it. His expression changed. He held up one finger, the universal gesture for one moment, and stepped 3 feet to the side, turning his back to the room. She watched his shoulders. She watched the back of his head. She watched the way the conversation lasted 30 seconds, and then 20 more, and then he turned back and he was looking at her differently than he had 30 seconds ago. Not the formal authority delivering look, something else, something that had been updated by whatever had come through the phone. Ms. Merritt, he said, I need to ask you something before I continue. She waited. The Callaway incident report, he said carefully. Beyond the records correction, are you aware of any additional documentation related to events during that operation that has not yet been submitted to the investigation? She looked at him. She looked at Voss. Voss's expression said he didn't know what Steck was referring to. What kind of documentation? She said. Steck looked at the woman beside him, the legal officer, and then back at Claire. We've just been informed, he said, that a second set of records has been found in Pharaoh's personal files seized this morning, records that predate the alterations. A pause. Records that appear to document a second incident during Callaway that was never reported through official channels at all. The lobby was completely quiet now. Even the information desk attendant had stopped pretending not to listen. A second incident, Claire said. Involving you, Steck said. And involving a decision that was made during the operation that, if the documents are what they appear to be, changes the scope of what we're looking at significantly. He looked at her with the expression of someone delivering an incomplete sentence because the complete version required more than he had yet. Miss Merritt, before I go further, is there anything about the Callaway operation that you haven't disclosed to the investigation? She looked at him. She looked at Voss. She looked at Pulaski and the 5 men behind him. And then she looked at the folder in her hands, the letter that 6 people had signed and passed around rather than typing multiple copies, the letter that had answered a question in its 3rd line, the question she had been carrying for 12 years, the question about a specific moment in the Callaway engagement, a moment she had never reported, not because she had done something wrong, because the person she had protected in that moment had never known it happened. She looked at Voss. His face was asking the question before his mouth could. Raymond, she said. He looked at her. There's something I need to tell you, she said, about what actually happened at Callaway. All of it. The lobby held its breath. 6 veterans standing near the entrance, a brigadier general with an open briefcase, a legal officer with a closed expression. Raymond Voss in a wheelchair by the elevator, dressed in civilian clothes, looking at her with the particular stillness of a man who had just realized he didn't know the whole story. Claire looked at all of it and made the same kind of decision she had always made. Not the easy one, not the one that protected her, the one that was simply true. There's a room down the hall, she said to Steck. We can talk there. It took 40 minutes. Steck, his legal officer, Voss, Pulaski, and Claire in the consultation room off the main lobby. The same kind of institutional space as every other consultation room, table and chairs and nothing on the walls, designed to be neutral and achieving it perfectly. She told them about the second incident in sequence, the way she'd been trained to report things. Not the emotional version, not the version that had lived in her chest for 12 years. The factual version, which was what they needed, and which happened to also be the version that hurt the most to say out loud. During the Callaway operation, on the 3rd day of the engagement, there had been a moment that wasn't in any report. A moment that she had made a decision not to file because filing it would have required identifying what she'd seen and why she'd acted. And identifying it would have exposed a failure of command that she had decided, at 26 years old, was not hers to expose. What she had seen, a command error, not Voss's. The admin officer, Pharaoh, though she hadn't known his name then, only his face and his rank, making a call in the field that had put 3 soldiers in a position they should never have been in. A positioning error that created a crossfire risk that shouldn't have existed. What she had done, She had seen it developing in real time, from her position treating casualties 30 meters away, and she had used the only tool she had available, her radio, which was technically outside her operational authorization to use for tactical coordination, to warn the 3 soldiers before the crossfire closed. They had moved in time. They were all alive. She had never filed the radio use because filing it would have meant documenting why she used it, which would have meant documenting what she'd seen, which would have meant an official record of Pharaoh's error. And Pharaoh had outranked her by 2 grades and had been standing right there, and she had been 26, and she had made a call that she thought was protecting the people around her without burning the institution down around everyone's ears. She had been wrong about that. Not about the radio call, about the silence after it. When she finished, the room was quiet. Steck looked at his legal officer. The legal officer made a note. Pulaski was looking at the table with the expression of a man confirming something he'd suspected. Voss was looking at her. "The 3 soldiers," he said. "Yes," she said. "Decker, Marsh, and—" "I didn't know their names then," she said. "I knew their positions." He looked at the table, then back at her. "Decker lost both legs 8 months later in a separate engagement." His voice was quiet. "Marsh retired last year. He's been in VA care for a spinal injury. The third—" He stopped. "The third is in this room." She looked at Pulaski. Pulaski met her eyes. He had known. That's why he was here. That's why there were 6 of them, not 5. Not just witnesses to Calloway generally, but specific people with specific debts that they'd been carrying in the specific way you carried something when you didn't know who to return it to. "I didn't know it was you," she said. "I know," Pulaski said. "We didn't know who made that radio call for years. Pharaoh told us after the fact that it had been a glitch in the equipment, a transmission from another unit that happened to be on our frequency." He paused. "We believed him because we were alive and grateful and not asking questions you don't ask when you're grateful." He looked at her steadily. When the investigation started and the statements started coming out, the radio call came up. Doran found the transmission log in the original operational records, the ones Pharaoh hadn't managed to alter. "I say." A pause. "Your call sign was on it." Sign was— The room absorbed that. Steck cleared his throat in the specific way of someone bringing a room back to its procedural function. "Ms. Merritt, the unauthorized radio use, given the circumstances and the outcome, this is not something that the JAG review intends to pursue as a violation. The context is documented. The result speaks for itself." He paused. "What it does change is the scope of the commendation review." She looked at him. "The commendation Colonel Voss originally filed," Steck said, "was for the field medical care during the engagement. The radio incident, if it had been documented at the time, would have generated a separate citation." He looked at the legal officer, who nodded. "We cannot retroactively create what should have been filed, but we can formally annotate the record with the full account, including the radio action and its outcome." He paused, "And that annotation triggers a second commendation review." The room was quiet. "You don't have to decide anything right now," Steck said. "This is information. The process takes its own time." "I understand," she said. "There's one more thing." He reached into the briefcase again. This time he pulled out a single sheet. Official letterhead, the kind that had a weight to it that regular paper didn't. "This is a formal offer. It's not a requirement, and it carries no obligation to your current employment." He set it on the table in front of her. "Given your service record, corrected, and your current medical qualifications, the Army Medical Corps is formally inviting you to consider a reserve commission, part-time advisory capacity, specifically related to combat casualty care protocols and the training pipeline for deployed medical personnel." He looked at her. "You left with knowledge that is still relevant. There are people who could use it." She looked at the letter, didn't pick it up. "I said there's no obligation," Steck said. "I mean that." "I know," she said. The meeting ended at 7:40. Steck and his legal officer left first, with the particular efficiency of people who had many things to do and had accomplished what they came for.
Pulaski and the other 5 men stood in the lobby with less certainty about how to leave. There was something unfinished in them. She could see it. The kind of unfinished that didn't resolve with a meeting and paperwork. She walked to them. Pulaski straightened when she came close. The others did the same. Not performance, not ceremony, just the habit of people who had spent years in contexts where how you held yourself when something mattered was itself a form of language. "I don't need you to stand like that," she said. "I know," Pulaski said. He relaxed slightly. The others followed. "We came because we wanted to, not because the investigation asked us to." He paused. "We wanted to look you in the face and say it, that's all." "You said it," she said. "I heard it." He nodded. Then, quietly, "Decker can't be here. He lives in Roanoke. The travel is hard for him now. But he knows we came." A pause. "He asked me to tell you. He has 2 daughters, 8 and 11. He stopped. "He wanted you to know that." She looked at him. The information settled into her without dramatic response, which was how important things usually settled. Not like an explosion, more like a key turning in a lock that had been stiff for a long time. "Tell him I'm glad," she said. Pulaski held out his hand. She shook it. He held on for a second longer than the handshake required, which was enough. She shook all 6 hands. They left. She stood in the lobby alone for a moment. Then she went back to the elevator and went up to the 3rd floor. Voss was in his room. Davis had gotten him back up to 318 after the meeting, and the effort of the evening showed in his color and in the way he was leaning against the pillows. Not the controlled stillness of yesterday, but actual tiredness, the body calling in its debt from an hour in a wheelchair and 40 minutes in a consultation room when what it had needed was rest. She came in, sat in the chair. Neither of them spoke for a moment. "You saved Pulaski's life," he said, "and I didn't know." "You couldn't have known. I didn't report it. You should have told me." "Yes," she said. "I should have." She looked at him directly. "I was 26 and I made a call that I thought protected everyone, and it turned out I was only half right. That's the truth of it. I'm not going to dress it up." He looked at the ceiling. "Farrow saw you make the radio call. I assumed as much. I just didn't know what he'd done with that knowledge until now." "He used it," Voss said. "He used the unauthorized radio call as the hook for the fabricated report. He built the narrative around the one real thing, that you'd acted outside your technical authorization, and wrapped a lie around it." His jaw tightened. Because he knew if anyone ever looked at why you'd done it, it would expose his positioning error. So he made sure the why was never in the record. "And when the investigation started looking," she said, "he came here to get your documents before anyone could cross-reference them with what the transmission log showed." "Yes." He was quiet for a moment. He almost got away with it for a second time. "Almost," she said. The monitor beeped steadily. Outside, Dunmore City was fully dark now. Not the dramatic dark of open country, but the ambient dark of a city at night. Light everywhere and none of it useful for seeing clearly. "The commission offer," Voss said. "I saw it." "What are you going to do?" She sat with the question. She had been sitting with it since Steck put the letter on the table, buses, not running from it, just letting it exist without forcing it into a shape before it was ready. "I don't know yet," she said. "I have a job. A good one. I'm good at it." "You're exceptional at it," he said. "That's not the question." "I know what the question is." He waited. "The question is whether this—" She gestured at the room, the hospital, the ordinary clinical texture of 318 in the evening. "Is what I'm supposed to be doing, or whether it's what I chose because it was the version of the thing I could do without the part that hurt." She paused. "And I don't know the answer to that yet." "That's honest," he said. "You keep saying that like it's surprising. For most people it would be." He turned his head to look at her. "Whatever you decide, the Reserve Commission, staying here, something else entirely, you should know that the commendation, when it's formally processed, is going in at the highest level the review supports." That came from Steck directly. He paused. "It's going to be documented in a way that anyone who looks at your service record will see, permanently. No more gaps, No more wrong story. She looked at her hands. 12 years. The wrong story for 12 years, written by a man sitting in a federal holding cell who had built a career and a contractor identity and a false name on top of the silence of a 26-year-old medic who had made the choice not to burn everything down. She thought about the weight of that, about whether it made her angry. It did, in the specific contained way that things could be simultaneously unfair and over. The anger of something that had already been decided, that didn't need to be fed anymore, that could be acknowledged and set down. "I'm not sorry I didn't report the radio call at the time," she said. "I know. I made the right call in the field. The silence after, it was the mistake." She looked at him. "I've been carrying both of those things at the same time for 12 years, and they didn't always sit comfortably next to each other." "They rarely do," he said. "The right call and the consequences of the right call aren't the same thing. Anyone who's commanded knows that." She nodded. "Claire," he said. She looked at him. It was the first time he'd used her first name. "I'm sorry," he said. "I know I've said it before. I'm saying it again because once didn't cover it." He held her gaze. "I failed to protect your record. I failed to follow up when I should have. I trusted a process I should have audited." He paused. "Those are on me. Not on Pharaoh, not on the institution. On me." She looked at him for a long moment. Raymond Voss, decorated, flawed, stubborn, capable of throwing trays and calling federal agencies and sitting in a wheelchair in a hospital lobby in civilian clothes to be present for something he felt he owed, was not a simple person. She had known that from the second day. Simple people didn't become interesting under pressure. They just became more of what they already were. He had become something different under pressure, which meant there had been something worth finding underneath the armor. "I know," she said, "and I know you've been trying to fix it." She paused. "That counts for something. Does it?" "Yes," she said. "It does." He let out a breath. Not relief, something more complicated than that. The specific exhale of a person who has been carrying a weight for long enough that the absence of it doesn't feel like lightness immediately. It feels like recalibration. "Get some sleep," she said. "Morrow wants you walking tomorrow." "I know. And eat all of the breakfast tray, not half." "I'll consider it." She stood. "Raymond." He looked up. "The thing you did in that lobby tonight," she said. "Coming down in the chair when you didn't have to. Being there." She paused. "That wasn't nothing." He nodded. "Once. Precise." She went out. The next 48 hours moved the way the aftermath of crises moved, in bureaucratic waves, each one slower than the one before, the urgency draining out of the situation as the formal processes took over from the human ones. Pharaoh's plea was finalized on Friday morning. The terms were what Garrett had said: full cooperation in exchange for reduced charges. Obstruction dropped to a lesser offense. The records tampering charges stood. He would lose his contractor clearance, his DOD access, his federal employment eligibility for life. The plea was public record: his name, the charges, the nature of what he had done. A press brief from the JAG office mentioned the case in 4 lines, which was 4 more lines than it would have received if the record correction process hadn't been formally filed at the same time. Dennis Pharaoh's name was in a public document next to the words falsification of military service records, and that was permanent in the way that only public documents were. The commendation review took until Friday afternoon. Steck called Doran, who called Garrett, who called Claire while she was doing Voss's afternoon vitals. She took the call in the hallway. The review had found that the events of Callaway, including the radio incident, supported a formal commendation at the level of an Army Commendation Medal, and that the circumstances of the field medicine, taken in full with the newly corrected record, additionally supported a recommendation for a higher decoration that would go through a separate review process. That second process would take weeks, not days. She thanked Garrett, put the phone in her pocket, went back into 318 and finished the vitals. Voss looked at her. "Well?" "Commendation medal confirmed," she said. "There's a second review for something higher. Takes longer." He looked at her with an expression she'd learned to read over 5 days. The controlled version of something significant. "Good," he said. "It doesn't change anything today," she said.
It changes the record, he said. That changes everything. She didn't argue with that because he was right. What? Price had gone quiet. She didn't know exactly what conversations had happened at the administrative level between Steck's visit and Friday morning, and she didn't ask. What she knew was that the patient advocacy filing remained on record, that the HR background review was formally suspended, and that on Friday afternoon, Deborah Falk appeared at the nursing station with a letter from Price's office. She read it at the station, standing, in the way she read everything she needed to assess quickly. It was an apology. Official, formal, carefully worded to avoid admitting specific wrongdoing while still clearly acknowledging that the reassignment attempt and the background review had been inappropriate given the circumstances. It cited the patient advocacy documentation and the federal involvement and recommended that her employment record reflect no adverse action related to the events of the week. It was the kind of apology that institutions wrote when they had been caught doing something they couldn't defend and had decided that forward motion was better than entrenchment. It wasn't the apology she would have written for him, but it existed, which was more than these things usually managed. Deborah was watching her read it. "Is it enough?" Deborah said. "It's what there is," Claire said. She folded the letter. "The nurses he went after before me, the ones who filed HR reports after Voss's previous admissions. Are those reports still on file?" Deborah looked at her. "Yes." "Those nurses should see this letter." She set it on the desk, not because it fixes what happened to them, because they should know that someone pushed back and it went on record. Deborah picked up the letter. "I'll make sure they see it. Ciao." Saturday morning, Voss was discharged at 10:15. The physical therapy team had signed off Friday afternoon. He could manage transfers. He understood the wound care protocol. He had an outpatient PT schedule and a home health aide arranged for the first 2 weeks. Morrow had reviewed everything personally and had written a discharge summary that was thorough in the way her work always was. Specific, honest, no softening of the road ahead. The road ahead was real. The right calf would never be exactly what it was before. The physical therapy would be difficult and long, and there would be days, probably many of them, when the gap between where he was and where he'd been would be harder to sit with than the original surgery. She told him this directly on Friday evening, because managing expectations was part of the job, and also because he would have resented being protected from it. He had said, "I've had worse transitions." She had said, "I know." But those were different contexts. He had said, after a pause, "Yes, they were." The discharge itself was the ordinary kind. Forms, instructions, a prescription printout, the wheelchair ride to the lobby that patients always said they didn't need and always took anyway because the hospital required it. Davis was on shift and handled the paperwork with the efficiency he'd been developing all week. Claire walked beside the chair. In the lobby there was a car waiting, a service, not a friend. He had no one to call, and he had called a service instead, which was practical and also quietly sad in the way that things were when they were both. The driver had the car at the curb. She stopped beside the wheelchair. He looked up at her. The morning light in the lobby was the flat institutional kind, nothing cinematic about it, just light doing what light did. He looked like what he was, a 61-year-old man who had been through surgery in a federal situation and 5 days of being known by someone who'd earned the right to know him. "You need anything before you go?" she asked. "No." He reached into his jacket. "I want to give you something." He held out a card. Not a business card, a handwritten one. A name and a number in precise block print. "That's my personal number," he said. "Not the one in the hospital system. Mine." He paused. "You don't have to use it, but I wanted you to have it." She took it, looked at it, put it in her pocket. "When you decide about the commission," he said, "I know people in the medical corps advisory structure. If you want an honest assessment of what the role actually involves, not the official version, I can connect you." A pause. No pressure. Genuine offer. "I know the difference with you by now," she said. Something shifted in his expression. That almost smile she'd seen a handful of times across 5 days, more real than most people's full ones. "What happens to you now?" he said. She thought about it honestly. "Same as before, mostly. This floor, these patients, this work." She paused. "And a second review process that takes weeks and an offer letter sitting on my kitchen table that I haven't picked up yet." But you haven't thrown it away. No, she said. I haven't thrown it away. He nodded, reached forward and extended his hand. She shook it. He held it for a moment. Not long, not sentimental, just the specific length of a person saying something in the only register that felt proportionate. Thank you, he said, for all of it. The parts that were your job and the parts that weren't. Take care of the leg, she said. Yes, ma'am, he said. She watched the driver help him into the car. She watched the car pull into the Dunmore City morning traffic and disappear around the corner. She stood at the lobby window until it was gone. Then she went back up to the third floor and finished her shift. 3 weeks later, on a Tuesday morning, Claire Merritt sat at her kitchen table before work with a cup of coffee and the offer letter flat on the table in front of her. She had read it 6 times. She knew what it said. She had looked up the role, the structure, the commitment level, the implications for her current position. She had not made a decision because she had been honest with herself that making a decision before the information had settled into something she could trust was worse than waiting. The waiting had been its own work. She had gone back to the floor after Voss's discharge and done what she always did. Her job, well, without announcement, patient by patient and shift by shift. She had told Deborah carefully enough of what had happened that the charge nurse could understand the shape of the week without needing every detail. Deborah had listened and then said, I've been a nurse for 23 years and I've never seen a patient advocacy filing move that fast. And Claire had said, it had help. And Deborah had said, yeah, I know, so did the patient. The commendation had been formally entered into her record 9 days after discharge. She had received a letter confirming it, official letterhead, military formality, the specific language of institutional recognition, and had read it standing at her kitchen counter and then set it on the table and left for work. The second review was still pending. That was a longer process, and she had made her peace with its timeline. Pulaski had sent a text 3 days after the lobby meeting. Just, Decker says thank you. His daughters' names are Eva and Rose. She had read it on her lunch break and gone back to work and thought about it for the rest of the shift. Voss had not called. She had not called him. That was fine. The card was in her wallet and she knew where it was, and neither of those things required immediate action. Some things got handled in their own time. She picked up the offer letter. Read it again. This time, not to absorb information, but to feel her own reaction to it. The specific way her chest moved when she read certain phrases. The thing that happened in her body when she imagined saying yes versus the thing that happened when she imagined saying no. The window above the kitchen table had a view of the street, Caldwell Street, Dunmore City, ordinary and unglamorous in hers, in the way that places become yours when you've moved through enough time inside them. She thought about a 26-year-old woman in a field engagement zone making a radio call that wasn't in her authorization and then going back to treating casualties without pausing, because the next person in front of her needed the next thing, and the alternative to doing the next thing was not something she had ever been able to locate in herself. She thought about the 12 years after, about the 3 cities, about the locker room at 652, and the slow accumulation of ordinary shifts that had been, she understood now, neither hiding nor settling. They had been the thing she had needed to do until she was ready for the next thing. And maybe you couldn't know you were ready until the readiness was tested from the outside, and you watched yourself not break. She thought about what it meant that the record now said what had actually happened. She thought about Eva and Rose. She picked up the pen from beside the coffee cup. She signed the letter. It didn't feel like a dramatic decision, which she had learned was how the right decisions usually felt. Not like a turning point, more like a direction you realized you'd already been moving in. The paper moved. The world didn't. She was still in her kitchen on Caldwell Street with her coffee getting cold and a shift starting in 90 minutes. She folded the letter, put it in the envelope she'd had ready for a week, sealed it, set it by her bag so she'd mail it on the way to work, finished her coffee. There were things she knew sitting in that kitchen on that Tuesday morning that she hadn't known 5 weeks ago. She knew that institutions were neither reliable nor irredeemable. They were what people inside them did with them, and the people inside them included her. She knew that carrying the right version of a story in your own chest while the wrong one lived in a file somewhere was a particular and invisible kind of burden, and that putting it down didn't feel like relief so much as like finally being able to stand up straight and see how far the room actually went. She knew that the nurses who had walked out of Raymond Voss's room in the first 40 minutes of his admission, had not done anything wrong, and that she hadn't done anything magic, and that the difference between what they'd done and what she'd done was not quality or training or courage. It was that she had been in rooms like that before, and she had learned, the hard way, that the only way out of them was through. She knew that she was good at this. All of it. The clinical work, the human work, the work of staying in the room when staying was the hardest available option. She had spent years treating that knowledge as a private fact, something to be applied without being named. She was done treating it that way. She put on her jacket, picked up her bag, picked up the envelope, opened the front door. Dunmore City in the early morning was the same as it had always been. Mid-sized, unremarkable. The kind of city that didn't ask questions about the people who chose it. She had chosen it for those reasons and stayed for different ones, and that was the way it usually went. She walked down the steps and turned toward the mailbox on the corner. She dropped the envelope in. She kept walking toward the hospital. Nobody who passed her would have looked twice. Just a woman, beginning of a shift, walking like she knew where she was going. This time, that was exactly what it looked like, and it was exactly true. The people who get underestimated the most are often the ones who've seen the most. They don't announce it, they don't perform it. They just stay in the room when everyone else leaves and wait for the truth to catch up to them. It always does. It just sometimes takes longer than it should, but when it arrives, it changes everything. Not just for them, for every person who watched it happen and finally understood what they were looking at. Don't be so quick to decide what someone is based on where you found them. The story you think you're reading is almost never the whole one.